Ryan, looks like the on-air button is ready, and we will wait for the mayor's cue.
All right. I'll begin recording now, and the mayor can begin whenever ready.
All right. Well, let's get going. Welcome, everyone, to the Thursday, January 5th, 2023 meeting of the Boulder City Council. Welcome and a Happy New Year to all. Before we do our roll call, I'm going to turn to Councilmember Benjamin for our lead-in joke of the year.
Yeah, it's 2023. Happy New Year, everybody. Why is New York City's New Year's celebration always so overrated? Every year they drop the ball.
All right. Timely. Very good. And on that note, I'll call us to order and ask Elisha to do our roll call.
Thank you, sir, and happy 2023 to everyone, and thanks for joining us. We will start tonight's roll call with Councilmember Benjamin.
Present.
Mayor Brockett.
Present.
Councilmember Folkerts.
Present.
Friend.
Here.
Joseph.
Present.
Spear.
Present.
Mayor Pro Tem Wallach.
Here.
Councilmember Weiner.
Present.
And Yates.
Here.
Mayor, we have our quorum.
Thanks so much. And I'll just note Councilmember Spears joining us remotely to avoid chances of infection. So appreciate your thinking of our health there, Nicole. And then I also turn to Tara. You also have a health thing you'd like to talk about.
Yeah, I have an announcement. No, just kidding. I had knee surgery about 2 weeks ago, so you're going to see me walking in and out of this room so I don't sit too long, and I apologize ahead of time.
Very good. And with that, I'm going to ask for a motion to amend the agenda to make three changes. One is to add item 1A, our first item, of an update and discussion regarding methamphetamine levels discovered at the main library, with Boulder County Health present as well. To remove item 8A, a council discussion on proposed boards and commissions liaison duties, which has been moved to the January 12th study session. And finally, to correct item 4B, to correct the address of the utility easement from 3320 28th Street to 3265 30th Street.
So moved.
Second.
Motion and second. All in favor? Raise your hand. That's unanimous. The agenda has been amended. And so we will go right into item 1A, which I just described. And I'm going to start by heading over to Deputy City Manager Chris Meschuk to get us started, please.
Thank you, Mayor. Good evening, council members. And I'm just going to do a very brief intro for this item. Our city manager, Nuria Rivera-Vandermeid, is on vacation, but has joined us for this item remotely. So I will turn it over to Nuria, who's going to kick it off. And then we will have David Farnan, our library director. And then we have two representatives from Boulder County Public Health that are joining us tonight as well. So with that, Nuria, take it away.
Thank you so much, Chris. Can you hear me all right?
Yes.
Yep.
I appreciate being able to join you this evening, though note I may have to turn my video off as heavy rains where I am are causing some connectivity issues. So I think I'm also just a little blurry. I apologize for that. It was important for me to be here today. It's an important discussion. It comes as no surprise to our community that meth continues to be the fastest growing drug and epidemic nationwide. I want to thank Councilmember Friend, who recently asked if we could schedule a more in-depth conversation about meth and the impacts it's having on our organization and in our community. We too believe this is an important conversation and are looking to devote time at an upcoming study session to delve into this topic from various perspectives across the city departments, as well as possible community partners. But for today, we wanted to provide you with an update concerning the library. Over the past months or so, we have experienced a troubling number of suspected reports of drug use in the bathrooms at our main library. So much so that our library director, David Farnan, who will provide you with more detail in just a bit, called for testing to determine what exactly we were dealing with. Those initial test results originally focused on the bathroom areas. They came in on Monday, December 19th, and after consultation with our public health partners, as well as the expertise of our facilities and fleet department and our risk management department and finance, we called for the library's closure. At that time, we did not know the extent of the contamination, but I could not in good conscience have staff and the public invited to a public facility where we needed to do more environmental testing throughout the building to put together the appropriate remedial plan. I want to thank Lexi Nolan, Bill Hayes, Joe Malinowski, and any additional Boulder County Public Health staff who supported us throughout the process, many who disrupted their holiday plans and vacations to assist. We are so appreciative of the continued partnership and support we've had from you. I'll note that we have representation from Boulder County Public Health with us today to answer questions as well. But first, I'll turn it over to our library director, who, alongside so many other city staff who worked quickly throughout the holidays as well to address this issue and put together a mitigation and reopening plan for the city. I want to thank that quick work from staff, and I'll turn it over to David Farnan for additional details. David?
Thank you, Nuria. Good evening, Council. Thanks for this opportunity to come and tell you what happened. My name is David Farnan. I'm the Library Director for the City of Boulder. I want to open up with just some brief marks about what the library is and what we do. Typically, I will go into some detail with regard to what unfolded over the last 4 weeks, and then describe to you a little bit what the plan for reopening is and what the library is going to look like when we reopen. So the library, as you all well know, is one of the busiest public facilities in the city of Boulder. Prior to the pandemic, that meant roughly 2,000 visitors a day to the library downtown. Since the pandemic, those numbers are off, but it's well over 1,000 visitors a day. 99% of those visitors who come to the library every day are using it for its intended purpose, and I need to stress that highly. The plurality of those daily attendees, far and away, are dominated by children and families. So they make up easily 30% of the people who are walking through the door, and well over 50% of all of my business metrics at this point. Books checked out, programs attended, that kind of thing. But if you look at the cross-section of the people who walk in the door, it is literally a cross-section of our entire community. They are students, they are retirees, they are folks who come in to read, they are folks who come in to experience community. They are both unhoused and housed. The library is free, as you know, and open to all. The barriers to entry are few, if none. So long as you do not break any law and you adhere to the library's behavioral guidelines, you are welcomed, you are treated with dignity, and you are treated with respect. So I want to open up a little bit here about while of course there have been intermittent issues of drug use in the library over the course of time. We have one documented arrest in 2022 prior to this, and one suspected attempt at drug use, which was dealt with. I did suspend that person for 364 days, although I'm not a court of law. I am not a law enforcement officer. It was a breaking of our behavioral guidelines for disrupting library service, and he was suspended. The incidents that began this year began on November 23rd. On that day, we had 2 documented incidents of smoking in the bathrooms. We closed, the police and the fire department were called. We happened to have a hazmat investigator who came with the fire department. He was unable to detect any chemicals. He was unable to detect any CO2 displacement, which means he was unable to even detect that there had been a fire in the space. So at that time, the next day we were closed for the holiday. We discussed at the time, the building facilities maintenance manager and I, that we didn't know what it was, but we suspected narcotics. At that time, we reopened after the holidays. There was again another incident. At that time, some staff members, 6 staff members, 3 security guards, 2 cleaning crew members, and one of my frontline staff walked into the smoke-filled bathrooms. 2 of those staff members reported dizziness. I also went into the bathrooms. I felt no symptoms. We had everyone checked out by paramedics, and paramedics, as is their way with a sense of humor, reported that all of the 6 individuals were much healthier than myself and or the facilities maintenance manager, which I thought was humorous, but we were still left with scratching our heads because we didn't know what was going on. We developed a protocol at that time, right? So any incident in which there was fire in the bathrooms, we would close the bathrooms, we would call the fire department, we would give at minimum 1 hour of time for the smoke and whatever was in the air to be cleaned, and then the day porters, the cleaning crew, the 2 day porters that we have on staff, would enter the bathroom with proper PPE and clean all of the surfaces before we would allow the public back into the bathroom. So that protocol was implemented at the very beginning. It was at the same time that the facilities maintenance manager and I met and expressed both concern that we did not know what we were asking the cleaning crew to go into, and it's specifically 2 people. We consulted with the hazmat person who was there on site. The facilities maintenance manager followed up then with the chief of the hazmat team for the city of Boulder and realized that the hazmat team doesn't do testing for drugs. We then chose to pursue a professional opinion at that time. In tandem, I reached out to the city manager's office and my supervisor, Chris Meschik, to talk with him, and we agreed that it was best if I would reach out to Chief Harold and Deputy Chief Redfern. I did so at that time. They immediately provided assistance to the library and attached me to a narcotics division. I met with that sergeant soon after, and we began work by bringing in an undercover team of narcotics detectives into the library to see if they could discern what was going on. We began at the very same time to share information with those undercover narcotics officers, including people who we suspected any suspect activity that we were seeing within the library that we could pick up on surveillance cameras, including in a couple of instances, places where we thought a person or persons could possibly be the nexus of some form of drug transactions going on. It turned out that that was not the case. They were not transacting drugs, and I learned a lot more than I ever thought I would learn about how users use drugs, but it's not unlike how a group of maybe, in the movies, alcoholics would share a bottle of alcohol. Drug users, typically one person scores, then 3 people score, and so they're quite often sharing drugs among each other. We began in tandem in both ways. So with facilities maintenance management, we were pursuing testing. With the police department, we were pursuing investigations. My security guards continued to monitor activity. We had 8 additional incidents between November 29th, or maybe 10, I guess it was, 10 incidents between November 29th and December 15th. On December 12th, the tester came out to the library. We closed the bathrooms for that testing so they could test the air ducts, which we were only testing the air ducts at that time. They tested the air ducts, and then on the 19th of December, we received the results of those tests. That was myself, the facilities maintenance manager, the head of risk, and the consultant who we had used to do the testing. We immediately set out to do a meeting with Boulder County Health, and from that point then met with the city manager and involved a lot of other people, at which point, as Nuria described, the decision was made to close the library and do further testing. I want to talk a little bit about what it's going to look like when we reopen. So I think one of the things that was, for myself, I've learned a lot more than I ever thought I would. I've been doing libraries for 30 years. I've never had anything like this in all of that time. I think one of the things that was probably most concerning to us is we knew we had to meet whatever the state guidelines were. So we have a remediation team now on site. They have been there since last week. They are actively cleaning all different areas. We brought back for the areas that were considered contaminated. So the bathrooms, all 6 bathrooms were at levels considered contaminated, as was one seating area outside of the bathrooms. That one was one that was probably deeply concerning to us because we learned all about dermal transmission. So unbeknownst to myself at that time, you can transfer meth from one surface to another via your hand. You can swipe one surface, pick up enough, and swipe it on another surface and provide some level of meth contamination, which, if you take that to its logical conclusion, is frightening, honestly. That led us to the library and what we're going to see when we reopen. We have decided to areas that were not necessarily contaminated, but potential areas for contamination in the future. We have decided to remove all upholstered furniture from the library that has already been discarded. We have looked at every single commonly used piece of equipment that is in the library that is not easily cleaned, and also made the decision that we will discard all of those items as well. And then we are going through the process of the remediation of the bathrooms. The library opened up on, 2 days ago or yesterday for Holds Pickup. Patrons are welcome to come into the library currently and pick up their holds and browse the fiction collection. And there's even actually a couple of chairs I saw people sitting in yesterday. But when we reopen more fully, I hope next week, after the remediation of the banquette seating area is cleared, we'll be fully open to the public and all of the cleaning is done. The biggest thing that they're going to notice is there are no public bathrooms. We will have no public bathrooms for probably the first 3 to 4 weeks as remediation continues in those spaces. And remediation means really tearing out air ducts, removing some of the contaminated areas and replacing them with new. That will take some time for those bathrooms are readily reconstructed. We have no intention at any time of reopening the bathrooms for unmonitored access. That is going forward, and that is going to be one of the things that when I mentioned that we have 2,000 visitors a day, I guarantee you that the public bathrooms at the public library are the busiest public bathrooms in the entire city of Boulder. We provide a lot of bathrooms. We are proud of those areas, but they will be on restricted access going forward. If you are with a child or the caregiver of a child under the age of 18, we have children's bathrooms. The children's area was in no way contaminated. We will be opening those bathrooms to parents and their caregivers beginning next week. We're doing a deep clean on them as well and actually cleaning all the air ducts, so that will be safe for people to return. But you will only be able to do it after interacting with a staff member or a security guard within the library and getting a key card access to get into those bathrooms, and that will be restricted to children under the age of 18 and their caregivers. The other bathrooms we expect to open up probably in about 3 to 4 weeks. One set of bathrooms will be restricted to staff access only. So a member would have to let a person in if they were having a medical emergency or had a legitimate medical condition. There are a number of medical conditions which we are required by law to provide access to the bathrooms. So for instance, somebody who has a colostomy bag, we have to allow them access to a bathroom in order to empty that bag. Someone who legitimately has diabetes, we have to let them use the bathroom in order to go to the bathroom. And we will do so. But the public access to the bathroom will be significantly restricted. To be clear, there was never a time when any illegal activity within the library was tolerated. It never has been. It never will be. We call the police in the event of any sort of crime. Staff are instructed to call the police if they suspect a crime is being committed, if they feel unsafe, or if they feel like a situation is out of control. Our Library Commission has approved guidelines of behavior, which we enforce with security guards and with staff at all of our buildings. I feel like those guidelines are mostly adequate to manage ordinary disruptions and to deal with the activities that may disrupt the operations of the library or inhibit our ability to provide safe public service. They have been effective up until this last event. I do believe, and the city has assured me, that we will have adequate resources to increase the number of security that we have in the building, as well as increased level of day porters to provide for a much more extensive and committed cleaning regimen on a daily basis. So I think that's everything I've got. I'm more than happy to take questions later, but I think I'm going to turn it over to Bob Hayes. Or is it Bob? Bill.
Thanks so much, David. So, Bill, if you want to come forward, and then we'll have questions after you've spoken. Then.
Good evening. My name is Joe Malinowski. I serve as the Boulder County Public Health Environmental Health Division Manager. Thank you for inviting us to the meeting today. I'm sure you're going to have a lot of questions, and we're going to try to answer those today. We are prepared to really talk about the sampling that occurred at the library. We're more than willing to come back. It sounds like there's going to be a meeting in the future, more of an executive session where we can invite some toxicologists and really some better experts than we are to really talk in depth and answer your questions probably even better. But Bill Hayes should be able to answer most of your technical questions tonight regarding the actual library contamination. I think one thing to keep in mind is that this is not a Boulder County issue. This is actually a national issue. We just happen to be diligent in Boulder County and actually are following regulations and public health guidance to do this testing to keep our citizens safe. And that's why we've had this program and the way the state does as well. So again, happy to answer any questions involving the library, and it can come back later at another time when we have some more experts. So thank you very much.
Great. So I'm going to turn to council for questions. But Joe, if I could just start with one quick one, just that David described some remediation approaches here. Are those sufficient to make the facility and the bathrooms safe for the public to visit?
I'm going to let Bill answer that question more specifically, but what happens after the cleaning, they have to do some additional testing to ensure that it's cleaned up properly. And that testing usually indicates whether or not the cleaning was successful.
Okay.
Bill Hayes. I'm the air quality coordinator at Boulder County Public Health. As Joe said, public health, we enforce the state statutes and regulations on meth cleanup. We don't prescribe how the cleanup is conducted, but as Joe said, at the conclusion of any remediation, we go back in, do testing, and it has to be shown to be below the limits. And listening to David just now, I was very impressed with the steps they have taken. I think, there was a number of situations that, you could have debated whether it was necessary to take such a step. And in every case, they took, the most conservative approach possible. So I am very pleased with the remediation work they're doing. But as I said, the proof will be in the follow-up sampling. And I would say Quest Environmental, who the city hired to do the initial sampling and who will do the post-remediation sampling, is a very good firm. Bob Woolner, who led the sampling effort, is one of the top experts on meth sampling in the state. He is certified by the state to do that work, and he trains others to become certified. So, you've got one of the best doing this work.
That's good to hear. So we'll do testing and then only reopen if the tests show that the levels are safe, I assume. That's going to be our
Yes,
approach.
yes. And I'm also, impressed with the steps that are being taken to prevent recontamination.
That's good to hear. All right, so council questions for any of our pieces? Rachel?
I'll start with a public health question in hopes that maybe, Bill, you can be in the right place already for the answer, but I don't know if it's for Joe. But I think there's a lot of community concern about, if you were in the library at the time of the contamination, might you be in any danger? So hoping that you can speak to that. And I don't know what the dermal transfer, is that the right word? Dermal? In the future, if we have incidents again, are members of the public at risk, either from what's happening in the bathroom or from, if somebody touches something in the bathroom and then out in the stacks or whatever? And is the risk any different for adults, kids, toddlers, elderly?
Yep. I'll try to remember all the points to tackle there. I should start out by saying that working on meth-affected properties is nothing new for Boulder County Public Health. We've been doing this for at least 7 years. But this is the first time we've dealt with a public building and a large space. So that's the wrinkle. And so we've worked very closely with the state Department of Public Health and Environment, and are even in consultation with CDC. The regulations as they're written, and not every state in the U.S. even has regulations for meth remediation. And when you look at the handful of states that do, we're kind of in the middle. Some have higher levels that trigger remediation, some have lower. New Zealand, who perhaps, as a country is ahead of us in addressing meth, they used to have a level that was 3 times higher than ours. And after years of looking at data, they decided that they could raise that limit to 10-fold. So, they have a significantly higher limit than what we have in Colorado. Our Colorado limit was based on essentially a worst case scenario. And to your question of who is, perhaps at more risk, certainly children are at the highest risk is what we consider. And so looking at a worst case scenario, it's a residence where either meth has been produced or consumed. And meth, as David was saying, it's sticky. and it gets into anything that's porous. And so in a house, a residence where you have meth contamination, it's going to be in the carpeting. It's going to be where the children are crawling around, touching things, putting their hands in their mouth. So looking at that worst case scenario, the state decided that a protective level would be 0.5 micrograms per 100 square centimeters. Little wonky, I know. But so that is what we consider to be a conservative level because it's looking at essentially worst case scenario. A scenario where people are, living exposed long term, exposed most hours of the day. So when you take that level and apply it to a public space where people are only there episodically and only a short duration, we do feel that, if we clean up to that level, it is very protective of human health, public health.
But if somebody's there and we haven't cleaned it up yet, say, if this happens again in the future, is there a significant risk of what we saw previously, of whatever we tested, and I think some members of the public are still a bit confused about, were they at risk? My understanding is probably not much, but I'm just hoping to clarify that.
Yeah, and the most common pathway of exposure is inhalation. So, as David was saying, had some employees walk into the bathroom where they saw smoke, inhaled it, felt ill. That's going to be the highest exposure. If you come in contact with it, dermal exposure, yes, it can absorb through the skin and affect you, but it's a much slower process, a much less amount of exposure. And, if you go home, wash your hands, it's going to take care of it. I should clarify, the reason that we have such a low standard, conservative standard in Colorado is that there is not a lot of data. We don't have the answers to all of these questions. So please keep that in mind, when I say this. But what we have seen in medical literature is that when people are exposed episodically to low levels of meth contamination, your body is able to process it, excrete it out in your urine within a day or two. Any health impacts that you might have, especially dermally, it would likely show up as a rash. But if it's a heavier exposure, you might have headaches, dizziness, fatigue. But typically, those are going to resolve within a day or two after you're removed from the contamination.
Super helpful. Thank you. And thank you for the partnership all along, and to our staff as well for working over the holidays on this.
Yep.
Okay, I've got Nicole on the same topic.
Yeah, just a quick colloquy. Thank you so much for all this information. And my question is just, because the dosage differs, right, depending on body size and things like that. And so the things you were just talking about in relation to Rachel's question, does that also apply to children or, younger, smaller, basically, bodies? Is that still, is there anything that would be different if we were talking about children? Even though, as I understand it, this wasn't the contamination, there was no contamination detected in the children's areas.
Yeah, as I said, those most at risk of impacts from exposure are going to be small children. And so when we worked with Quest Environmental on the sampling protocol, extra attention was given to the areas that, the children use and hang out in, to be, sure that we have those areas properly cleaned. And yes, certainly the same dosage to someone my size versus a little one, it's going to impact that smaller one much more.
Thanks. Mark, and then Junie.
Thank you for all that information as well. When I looked at the test results, there were three test readings that came in at greater than. Is your mic on? Yes, it is. Okay.
It's hard to hear you.
Yeah. Three test readings came in at greater than 75, I assume it's micrograms per 100 centimeters. And I inquired about that, and I was told that the tests don't record anything higher than 75 micrograms. Is that possibly accurate?
I think maybe we've got the decimal point in the wrong place.
Okay.
And without having the report in front of me, but I think actually the detection limit of the equipment, I believe, is 0.013 micrograms per 100 square liter.
Okay.
And the vast majority of all the samples taken were below the detection level of the equipment. And so there were a handful of samples that came back above the detection limit and above the screening limit of the regulations, and that's the 0.5 micrograms. And there was only one of those samples that was outside of the restroom area, and that was in the great room area.
Well, my question is, for those couple of readings that were outside of the limits, do we actually know the level of contamination in those areas if it just reads greater than as opposed to a specific number?
Oh, I see what you're saying. That yeah, the reports are sometimes you see that greater than, and yeah, it leaves you questioning. But what it really means is that it was a non-detect.
I think he's asking about the high levels.
At the highest
detected.
level, yes. Thank you.
The very highest levels that were detected.
Yeah, I'd have to go back and look. I don't recall seeing any that. So back up. I'm thinking of the sampling that was done after we sampled the air ducts. And yes, you're right. When we sampled the air ducts, there were samples that were above the top end of the equipment. And yes, 75 is the top end that the equipment can detect. And, at that point, you have to do remediation and get it under the 0.5.
Okay, so for those readings, we don't exactly know how contaminated those ducts were. Okay.
Right, but we know significantly contaminated, and we know we have to remediate. And as David said, in those cases, typically in ventilation systems, it's very impractical to think you can get in and adequately clean them, so it's just removed and replaced.
Okay. And my next question is, and this may not be for you, but the comment was made that meth is a national problem, which we all recognize. Has it been a problem specifically in libraries elsewhere?
Again, as Joe said at the beginning, I think here in Boulder County, we are addressing this more vigorously than a lot of communities, but certainly in Portland area, California, Seattle area, yes, we've heard of other libraries with similar issues. I don't know that they've done testing and identified. I haven't heard specific levels, but just in general, we hear across the country of libraries, illicit drug use happening in libraries.
And this may be a question for either Nuria or David. What's the cost to remediate? What is this going to cost us?
Yeah, if, I might jump in on that one, and then Joanna Korean, our Director of Facilities and Fleet, is here as well. My understanding is currently we've spent about $50,000 on testing. We've also spent about $50,000 on this initial phase of remediation. What will be remaining is the bathrooms, which we are in the process of competitively bidding right now. And so those are the current numbers that we have. Joanna, did I get that correct?
Do we have any sense of what the bathrooms are going to look like in terms of cost?
I'm sorry. So I'm Joanna Korean, Director of Facilities and Fleet. What was the last part of that? I didn't hear.
Do we have any ballpark estimate of what the bathrooms are going to cost us?
In terms of the remediation specifically? So to add on what Chris Mischuk was just saying, we're anticipating the remediation plus actually putting in new ducts and drywall, that kind of thing. So probably ultimately it'll be around $125,000, but we are still trying to get more bids.
And do we have any insurance coverage for that?
No.
Okay.
This would not be qualifying under our city insurance.
Okay, thank you.
Junie?
Thank you. My question is more likely for David. We received some emails, and as I was reading some of them, community members had some solutions, and I hear tonight you mentioned, and thank you for all the work that you've been doing, but hey, from what I'm hearing right now is that we're working on this, we have the possible solutions, but I haven't heard concretely what you're working on. So I'd like to hear some of that, because there were some concrete, for instance, one of the concrete steps that a community member mentioned to us is that, hey, are there sensors or detectors that we will put in place in the future? So maybe if you can tell us a little bit more about what we will be doing in the future to somehow, I'm not sure if you can stop someone from doing these type of illicit drugs, but how can we ensure we protect community? Right. And what are some of the steps that you're taking?
I appreciate the question. That is not for me, though. Thank you, Judy. That's a question for either city facilities or the city manager's office. I don't make determinations about such things. But
yeah, I can jump in, Junie. It's a great question, and it's something that I know we've got some folks that have been looking at that, and there's potentially a technology out of New Zealand that could be a meth detector. So we're going to try and learn more about that and understand. But then I think, as David talked about as well, looking into once the remediation is complete, is there also a way to ensure that there's monitored access to the bathrooms? In other words, is there a way to ensure that maybe we're trying to help prevent that behavior from even occurring in the bathroom? So those are all operational things that we're looking into.
Thank you.
So, I'm sorry. Yeah, to that point, Junie, then there are such things, believe it or not. Like, there are guards who are trained specifically in the health and medical conditions around, primarily for hospitals, but also for other kinds of facilities for monitoring bathrooms. And so we will be looking into getting guards certified in that, who can deal with people's various health conditions to determine whether or not to allow them in a case of emergency, and also then to regulate the bathrooms. We will be looking to those guards to determine how that access will be managed. I don't have the answer for it currently. Like, is it one person at a time? Are we able to handle 3 people at a time? Or I don't know the answer to that. Yeah.
Thank you.
If I could just drill in a little bit while you're up here, David. So I'm hearing that we're looking at potential technology solutions. So it's good to hear that we're investigating that. But you're talking about that a primary strategy will be in terms of limiting and monitoring access to the bathrooms. Is that right?
Yeah.
And so you're still developing the exact strategies, but the plan is to have security that will help prevent this from happening again. Is that?
Yeah, what we have requested is increased levels of cleaning and increased levels of security. So I have been assured that we will have that, and I believe that that's a possible solution. I mean, if you look at what has happened in Union Station, my family and I go there every year for the holiday, and it's gone through a number of different permutations. If you cannot go into a bathroom currently at Union Station without encountering at least one person who is there working. And in fact, if you actually ask for questions like, can I use the family bathroom, you will find that you are confronted with someone who wasn't there before within a minute, who is actually able to give you access to that bathroom. So there are ways that, I don't know that ours will need to be that extreme, but there are certainly other communities that have figured this process out. I don't think it's not cost neutral. I mean, it's going to require some resources, but yeah, I believe we can do it. I mean, the Union Station is in some ways back, and the bathrooms are certainly used, and I don't believe abused, but it requires quite a lot of resources to do it.
Great, that's good to hear. Because, of course, I think we all share the goal of having this never happen again, right? So it's good to hear that you all
is
are
correct.
doing.
And to answer Mark's question, we have been contacted since this event by 2 other libraries in the Front Range who are want to do testing. Okay. So,
and I think it goes without saying, we'll be very interested in your plans as you develop them. So please do keep us in the loop. I had Bob, and then Matt, and then Rachel.
David, this is for you, if you don't mind getting back up.
Yep.
David, I really appreciate you giving us the recent history, the things that have happened in November and December, and also your plans for the future. So that was great. I'd like to give you the opportunity to maybe back up in time. I think you've been the library director here for about 10 years.
Yeah, almost 10.
And so can you talk a little bit about some of the things that you and your staff have done by way of security in the library during the years leading up to this situation? Because I've heard that there's things you've done with respect to security, with respect to prevention of drug use and other inappropriate behaviors. And I'd like to hear a little bit more about what you've done through the years with regards to that.
Yeah, so the Library Commission approved of a guidelines some time ago, 10 years ago at least. They're behavioral guidelines. And so those behavioral guidelines obviously restrict any illegal activity, but it goes beyond that to restricts disruptive behavior. It restricts people lying down in the library unless they're under 10 years of age. It restricts the presence of any kind of drugs or possession of drugs or being inhibited by any form of drugs, and that includes legal substances. We do not allow for, if people are presumed to be intoxicated in the library, we frequently ask them to leave. So that is a common practice that that's been in place for a decade. We update those policies with some regularity. Staff receive quite a lot of training on a lot of different things, how to recognize and how to work with various communities. We've done everything from, extensive training on working with the unhoused community, extensive training on de-escalation, extensive training on how to work with the mentally ill. But I can tell you that I have not had training on, and my staff don't have either, is how to deal with a person who is high on methamphetamines. That is not something that we have the training for. What we do is what you do. We call the police. And so we don't really have the mechanism for dealing with people who are completely out of their minds on drugs. The history has been, I've had 5 security companies in 10 years, some really good, some less good. We go through the competitive bidding process. When I first arrived hired in 2013 and started in earnest in 2014. I don't know if any of you remember what Boulder Public Library was like at that time, but it certainly wasn't getting a lot of rave reviews. We went through a process of disrupting some untoward behavior in the library, and it was pretty severe, and I'm not sure that anybody, I know that I was thanked by a lot of people, but I'm not sure that we got any good PR for it, and I'm not sure that the police department got any good PR for it, but nevertheless it worked. And we went through a long period of time where things were relatively modicum of behavior. Like average, we may have somewhere in the neighborhood of about 2 suspensions a week. So a suspension could be you're in the library and you harass a staff member. You could be suspended for 30 days for that. You just tell a staff member so something like that. So the severity of the suspensions are consistent with the pattern either of disruption or, in the case of criminal acts, I have the ability through the behavioral guidelines to suspend somebody for up to 364 days, and we use it liberally. As you saw from the report that we shared with you a few days ago, or the communication shared with you a few days ago, all of the people who were involved in this incident that we could apprehend and identify as people involved in this drug incident, they were all suspended for 364 days. The crime of smoking methamphetamine in a public area is a misdemeanor. I don't know if there's any criminal sentence. Our stance has been that you have basically forfeited the right to come into the public library for at least a year, which is the maximum that I can give. We've had great support from the city attorney's office in terms of implementing those policies and effectively using that. Everyone, the city's attorney's office, as do you, I'm sure as well. We take very seriously the public having a right to an access to a public building, and we don't hand out suspensions lightly. We don't do it for no reason at all, but we do hand out suspensions probably to the tune of, on average, 80 a year. Those numbers went down from 2017 to 2019, but they've come back to 80 a year roughly throughout the pandemic, and I think we're probably on pace this year to beat that, primarily because of the events in November and December. But does that help answer your question, Bob? Yeah, okay.
Great. Matt, Rachel, Tara, Nicole.
Thanks, Aaron. David's going to get a workout tonight, getting up down. I'm not saying here specifically, but while you're here, I just want to recognize you and your staff, especially over the holidays, for having to just deal with a really difficult and impossible situation. Those are times where you should be spending time with your family, and you guys rose to the occasion to try to get this solved and try to get us to a good place as fast as possible. So thank you for that, and I just wanted to recognize you, and I know how hard that is for you and your staff, especially for those that work for you that do the thankless job of dealing with folks all day long, every day. So just thank you.
Thank you very much, Matt. And I did intend to apologize at the beginning of this if I seem in any way untoward or impolite. I am naturally a somewhat serious person. My wife tells me that sometimes my seriousness comes off as I seem like I'm angry or I'm impatient, and I assure you that I am none of those things. I have been through quite a lot of emotions with regard to this event, and I have been extremely angry, and as I'm sure some of you experienced by speaking to me over the phone, and I've been also extraordinarily sad. I am extraordinarily sad that this event happened, and I have to keep reminding myself of the high road, and that 99% of the 2,000 people who walk in there every day are using this library for its intended purpose, and a small fraction of people have changed now the disposition of the public library for the immediate future, and maybe for a long period of time. So.
Well, thank you, David. And your range of spectrum of emotions is emblematic of exactly the kind of leader we want running our library. So thank you for that, and I respect that a lot. Thank you. My question kind of circles back to something that Rachel brought up earlier, and it really kind of is about maybe setting some of the community at ease. As much as we might have framed this as a library piece, it's a public it's a public bathroom concern largely, right? And I think maybe it's important for us to maybe reframe it in a public bathroom space. And so in that question, and maybe this is a question for Bill, is this, we're coming out of the pandemic, so people have hygiene protocols. People either have them or still wearing masks, regularly wash their hands or have hand sanitizer at the ready. If people are concerned when they walk maybe into a public bathroom that they might be concerned about, would exercising those same COVID precautions that we've all become habituated to, are those reasonable precautions that people might feel are safe, would make them safe? If they're wearing a KN95, not knowing if someone maybe had done something in the bathroom 10 minutes or so before them, or regularly wash or pure all their hands, would people feel safe that habituated behavior will largely keep them safe if they accidentally come into contact or encounter a space that meth had may have been recently used in?
Yeah, and I'll start by saying that in my profession, I never use the word safe. When I hear safe, to me that means there is absolutely zero risk. And driving your car to the library has probably the biggest risk of your day. But certainly COVID has changed how we think about protecting our health in public spaces, and exactly what you just laid out would be beneficial in mitigating the risks from exposure to meth. Until this year, the last couple of years, flu season was very mild because all of the precautions we were taking for COVID. And so I think people have gotten used to that. And, if they are concerned, certainly, masking would reduce the exposure to vapors. Those masks are primarily for particulate and not vapor. But as we've said, the meth contamination vapor is in droplet form and sticky, so it would provide some benefit. But I think the hand washing is the biggest piece. I'm not sure hand sanitizer would make much of a difference, other than the alcohol may be a better solvent at breaking down the contaminants, but it's washing then those contaminants off that's going to be beneficial. And the first day I went into the library and looked in the bathrooms, and after all my years of experience, I couldn't believe that I did it, but the insides of the bathrooms have beautiful artwork on the walls, and I was noticing that it's a non-porous surface. It's an acrylic, I think, which is great because that makes remediation easier. You can wipe the surface and it didn't penetrate, but in all my years of experience, it was still, I had to touch it to make sure it was acrylic, and then I said that was stupid and immediately washed my hands.
I appreciate the answer to that, and just trying to give community comfort in terms of how they can give themselves some protection, because again, not knowing what is going on in the rest of the public bathrooms here or in other cities, it's just good to equip people with what they think may work, and if they've already habituated to it, then all the better in that capacity. But thank you, I appreciate that.
And if I can just add, I was talking with David beforehand, and my family we are big users of the Boulder Public Library. I have a daughter that just turned 13 and has done the summer reading program every year. And, I don't have any hesitation for, once the library reopens, letting her go back in.
That's good to hear. Rachel?
I think this question may end up being for Chris Meschuk when I meander around to it. So, obviously, our focus tonight is on the library, and I don't want to distract from that. I know we'll have a bigger conversation. I do want to, though, make note that it is a community-wide problem, meth, and there's been a lot of sort of vitriol aimed at David and the library, and I just want to acknowledge that I think, have sort of made the library a de facto day shelter. And David's risen to that occasion remarkably well during COVID, and that is something that we should not have asked the library to be, in my opinion. And that, I think the buck stops here for that being the setup there. So I want to just thank David and apologize that sort of the vitriol is landing there, because it's a community problem, and I don't feel it rests really with the library. So apologies. But David mentioned that this is the #1 place that people probably go to use bathrooms, and that we will need them to go probably somewhere else, because we don't yet have a day services or day shelter. So my question is, where will people go, and how will we keep those places safe? Safe-ish, because there's no real safe.
Thanks, Rachel, for that question. And we do have the public restrooms that are at essentially 9th and Canyon that are right around the corner from the library. So there are some public restrooms that are nearby while we're still finishing this remediation work for the next few weeks. And our Parks and Recreation team is making sure that they're doing everything they can to keep those bathrooms operational. And so the library staff will also have handouts available to those that are needing a restroom that maybe during this remediation period don't meet any of the medical criteria, to guide them exactly on how to get there.
And I assume we'll need some cleaning protocols basically at these restrooms as well.
Yeah,
possibly?
I mean, those restrooms receive a cleaning, and the biggest challenge that we face is vandalism of those facilities, and so we're doing everything we can to make sure that they stay operational.
Tara, and then Nicole.
I'm going to go back in time, since it's been about 15 minutes. I probably should have colloquied, but I wasn't on the ball. So now I'm going to have to ask whoever knows the most about the report. It says main level children's family large bathroom exhaust vent cover, 0.75 micrograms. And then it said for the main children's small bathroom, 1.2. So those are both above 0.5. So were the children's bathrooms affected? I'm just curious. Did it come through the vents? Is that because that was considerably lower than the whopping 75?
Certainly the children's bathroom was significantly lower, but each of the bathrooms' ventilation system is it's just an exhaust vent. It's completely isolated from the main ventilation system for the entire library, and so each bathroom exhaust vent goes straight up and out. And so for contamination to have been in the children's restroom air vent, it is most likely that someone smoked meth in that bathroom.
Okay. 75 is a lot, isn't it? Seems like a lot compared to 0.5.
It is. I think, the highest I've ever heard of is 2,000.
Okay. Thank you.
And so, but the reason it gets so high is it's a additive process. The chemical compounds in meth residue do not volatilize, they do not decompose, they do not degrade quickly. And so that number of 75 is really indicative of repeated use of meth in the bathrooms, and it accumulates.
Okay, thank you.
Yep.
Okay, David, first I want to thank you so much for last minute coming and for giving the community all the history and all the details. It was really meaningful, and I have to say that I have total confidence that you are going to take care of this to the best that it can be taken care of. So I have one question. You said mostly adequate in your when you spoke, that you felt that everything, the way you've been dealing with the problem with narcotics and meth is that it's mostly adequate. So the 364 days, do you feel that's adequate enough?
It's the city code. I understand both sides, right? So, but I would be perfectly honest. Like we have requested through risk management and through the city attorney's office in the past considerations for potentially extending that. I have, thanks to the city attorney's office, I have I have worked with the district attorney's office for quite some time, right? So if someone is convicted of a crime in the library, we typically work with the prosecutors in the district attorney's office. I typically work with the prosecutors in the district attorney's office to get whatever sentencing they have for that crime, the library suspension to be consecutive with. So someone may get 5 years for a sentence of a crime that was committed in the library. I can then get a 5-year suspension. It's not a workaround. Teresa's staff is the one who advised me of this like 7 or 8 years ago, that why don't you try to pursue this path? And so we did. I think when I said largely adequate, I meant the behavioral guidelines have been largely adequate for controlling the situation.
Yeah.
Any use of drugs is a criminal offense, and we prosecute to the full extent that we possibly can. I cannot claim to be the victim. The city doesn't claim to be the victim in crimes. In instances where crimes have been committed, I've requested to be the victim. Not just because we want to prosecute, and I don't, frankly, my staff, I have had, in the 10 years I've been here, I've had 4 staff members assaulted by the public. I try to convince them to testify, and I've been successful in one of those 4 cases. Most of them choose not to press charges for whatever reason. And in that case, in the most recent one, we did get an exemption from the city attorney's office that allowed us to, that staff member, rather than to list their home address in the testament, to list their home address. So there are things that we're doing. My sense on some crimes committed in the library, it's not many, but there will be one probably a year or one every other year. I mean, what I tell the police is, I don't want this person to ever be back in the library ever again. That's my, I have worked in other libraries where there wasn't a city code that limited to 364 days, and I was capable of suspending a person's right to be able to come into the public library ever again. But I understand the reasons why we do it. I mean, we are a public place. We all take seriously the right of the public to have access to public space. So I'm not gonna, I'll keep pursuing the possibility of extending that thing. I guarantee you I'll, be back at some other point complaining that I want to have a longer than a 364-day suspension. But it's not for me to say, really. We have ways when people are committing crimes to get them out for longer than that, and it's not a workaround. It's kind of like a tacit way that we then resort not to the city code, but rather to us, the county or the state, to enforce a sentence, which then allows that to override the city code of limitation of 364 days. Is that an okay answer?
Can I ask a clarifying, just to clarify for David on that one? Because obviously everything's going to be said tonight, it's going to be highly scrutinized, so I just want to clarify. I think when you said that when there is a sort of when the district attorney or when the person is convicted of a crime of a certain, so let's just say 1 year, that the suspension from the library is concurrent, not consecutive.
Yeah,
is that correct?
Concurrent, that's correct.
I think you said consecutive. I just want to make sure that it's concurrent.
Yeah.
So it's served together, not additive.
Yeah, it works when in my mind, I'm thinking I want somebody out of the public library for the rest of their lives, that then I get 3 years, then I'm grateful, right? That's a happy situation.
Perfect.
Wait. I just want to just finish. Is that all right? Unless it's a colloquy. Is it a colloquy? All right.
I was just curious. So how often when you give 364-day suspensions do we see like that person being suspended again? Like, is that something that's happening?
It has happened.
At what frequency?
It has happened. So, it used to stick much better, right? I mean, I think my experience during the pandemic, and certainly over the last year, is we were having a lot of people walk right back into the library, and we have to tell them, you're suspended for 364 days. What I'm allowed to do is extend their suspension from the date that they come back in. So we will extend the suspension for that many more days. So they're still, the date they come back in and say, like, no, I'm not, John Smith. And we say, yes, you are, and you're suspended for 364 days, and you're not allowed to be in here. Quite frequently, if they in those cases when they protest, we call PD, and police has them removed from the facility. And we are, we do oftentimes, although it's not something we have access to through the city code, the police officers and some commercial establishments have the ability to trespass someone. We don't particularly have the ability. I don't have the ability to trespass somebody from a city facility, but we asked them to leave for another 364 days.
I guess that's good to know. I was also curious about, once the 365 days are up.
Yeah, we've had a few that waltz back in and then mess up again, and they're back out for 364 days. It's a handful. I mean, my staff might know a little bit better than that. I know of one individual who we have suspended for 364 days. He has been suspended probably for the last 3.5 years, and maybe been able to be in the library for a few weeks in that 3.5 years.
Okay. Tara, do you want to finish up?
Yeah, I'm going to finish up. So it's just that small percentage. It's so unfortunate that.
We have about 80 suspensions a year. I mean, we'd have to we report that data every year. It's public information. We provide that information. I don't know off the top of my head how many of them are 364 days.
No, I'm done with this at 300. I was just saying it was unfortunate. The whole entire thing is unfortunate that those small amount of people had such a large effect on this entire community. That is unfortunate.
I absolutely agree, and this is probably what we've identified about 12 to 15 people. That's
it's
it.
terrible.
I mean, and yeah.
So I just want to say, and I can't speak for everybody, but I know that for me, I'm here for you. You're a partner of ours, and we don't want you to feel alone in this. And we're going to work together. And thank you for everything, and thank you, Chris, staff, and everybody that took a part in this. Security guards, you guys.
I got Nicole, and then come back to Mark, and we should wrap up here pretty soon. But yeah, Nicole.
Awesome, thank you. I had just a really quick one, and I don't know that it needs a response from staff. It's more just a question. Mark, you had asked about getting a summary of kind of the remediation costs as that becomes more clear. And I was just wondering if we could get one other number for comparison there. So David, as I understand it, the library has had among the biggest budget cuts in 2020 and 2021 of city departments. When you reopened, it was during a time when the homelessness crisis and the meth crisis were kind of on their way up. And when you reopened, you did not have all the staff that you had pre-pandemic who were helping the 99% of people who were not engaging in prohibited or illegal activity in the library, but also staff who were keeping an eye out for prohibited and illegal activity. So you basically did not have all the folks that you had before. So as we're looking at what these remediation costs are, I would really love to see a comparison of what would it have cost if we had given you, David, the staff that you needed in order to adequately staff the library to the levels that you needed in the first place to watch out for some of these behaviors that I think you were probably already even noticing. I think some of the stuff started really kicking off in 2019, even a little bit before that. So I would just really appreciate that when we're seeing remediation numbers to also see what would those staffing costs have been, just so that we can see what the comparison was for paying for remediation versus the preventive measures that might have kept us from this closure.
Okay, come back to that.
And also, I just want to echo the thanks, really, to everybody at the county, as well as David, to you, Nuria, everybody at the city who's been working on this for the last few weeks. Thank you.
Two very quick questions. The first is to the city attorney. Is it a simple ordinance to give David greater discretion in terms of the length of suspensions?
Mayor Pro Tem Wallach, I'm happy to look into that and get back to you.
Okay, that's great. And the next question is for David. There are many computer terminals, and obviously some of those are vulnerable to, I guess, tactile contamination. Is there a plan for how we're going to deal with those?
Yeah, so the current plan is already well underway. We have removed them all from the main public library. So there will be, I mean, I'm hoping this is a temporary action, but so what I've promised my staff and what I will promise the public is that we will bring back some form of public computing at the main library at such time that we feel like it's safe to do so. Right now, the public can use the George Reynolds and the Meadows Branch Library for public computing, and this is going to be a major inconvenience for a lot of people that I know on a first name basis, a lot of retirees and seniors in our community who use the public libraries, public computing every single day. And Lynn, I'm sorry.
And are there any steps you're going to take in anticipation of the possibility that other library branches might suffer the same problem?
Yeah, I've brought that up. I mean, my supervisor, Chris Mestrick, knows that, like, I think on November 24th, I said, I will close the bathrooms and I will restrict computers. And now we are. And so, like, that is a possibility at the branch libraries. It will require additional resources, but I'm fully ready if it becomes in any way starts to look like an unmanageable situation. I'm going to be back here asking for security at all the branches. And I'm going to be asking for monitored, regulated bathrooms, and there's a cost associated with doing that. Right now, we have had no incidents of any kind of drug use at any of the branch libraries.
And I want to echo the thanks of my colleagues for stepping up and dealing with this problem so directly and forthrightly. I appreciate that, and I think it provides some reassurance to the community. So thank you.
All right. I'm going to go ahead and wrap us up here. Yeah, so Matt, go ahead.
Not a question, just sort of as a maybe preamble ahead of open comment, and it's really kind of to echo what Councilmember Friend said, which is the public is justifiably angry, upset, perhaps even looking for blame, and I'll just ask that the community not focus their ire at David Farnan, our director, or his staff, or any staff. If you are looking for blame and looking to point that finger, point it no further than this dais, at this council and past councils. We are those that were elected to do this job and help lead this community. And if you're angry about how a public institution or infrastructure has been managed or has been afflicted by the issues in our society, look at us. And so I would just ask that you point that at us. Thank you.
Thanks for that, Matt. So, David, I just want to say another very large thank you to you and to your staff, right? We, of course, the meth usage and the meth contamination of the bathrooms is absolutely unacceptable. I appreciated you saying that illegal behavior has never been tolerated in the library, and I appreciated that when you saw problems occurring, that you took the steps necessary to deal with them, to do the testing, and once the results came back, to close the library quickly to make sure that there was absolutely no threat to public health. And I really appreciate the partnership from Boulder County Public Health. Bill, Joe, thank you very much for that, for working together with us and working so hard over the holidays to get the library closed and to get this remediation moving forward. So very grateful to all of you for that. And we stand ready here to partner with you and to take the necessary steps to prevent this from happening again and to make sure that the library is a safe place for all going forward. So come back to us with anything that you need. And so we look forward to hearing from more about your plans and let us know about any way we can help to Tara's point. And so with that, I'll just say again, thank you to all involved. Thank you for your time. Thank you for being here. All right. So we are now going to move on to open comment. And I'm going to turn to Ryan to read our public participation guidelines.
Thank you. Good evening, Ryan Hinchin here, serving the people of Boulder as Community Engagement Manager. And we appreciate community members being here tonight to share thoughts and perspectives during open comment and our public hearing. As we have slides coming up, want to clarify with everyone that the city has engaged with community members to create a vision for productive, meaningful, and inclusive conversations. This vision supports physical and emotional safety for community members, staff, and council, as well as democracy for people of all ages, identities, lived experience, and political perspectives. There's more information about this vision on the city's website. And on the next slide, I want to talk through a few different examples of rules of decorum found in the Boulder Revised Code and other guidelines that support this vision, each of which will be upheld during this meeting. All remarks and testimony shall be limited to matters related to city business. No participant shall make threats or use other forms of intimidation against any person. obscenity, racial epithets, and other speech and behavior that disrupts or otherwise impedes the ability to conduct the meeting are prohibited. Participants will be required to speak using the name they're commonly known by. Individuals will display their whole name before speaking online. And then from online participants, only audio testimony is permitted. With that, I'll turn it back to you, Mayor. Thank you.
Thank you, Ryan. Okay, we've got 6 folks signed up in person, and then we've got the rest, 14 more online. So we'll start with the in-person people. Each of you get 2 minutes to speak. Our first 3 speakers are John Neslage, Joel Gascoigne, and Chris Barge.
Maybe I can just set a couple over here too. If it's all right. Good evening, Council. Appreciate the opportunity to speak with you this evening. My name's John Neslage. I am here because I've taken a deep interest in the matter of not just health but safety in the library, primarily because of an incident that occurred almost exactly 1 year ago with my then 14-year-old daughter. On a Tuesday afternoon, 1:30 on a school day, she wandered over from Boulder High School to study and became the victim of a sex crime. A man hid behind some stacks and began masturbating within 10 feet of her and another young lady who were studying together. Shocking. But then again, what's on these boards show the over 1,500 times that the police or emergency services were called to the library over the last 3 years. Nothing new. In fact, I was even more alarmed to learn that even after meeting with Mr. Farnham and asking for remedial measures to be taken, that there were 8 further cases of indecent exposure in the library since January of 2022, when this happened to my daughter and our family. This isn't about just meth. It's about feeling safe and protecting the most vulnerable among us, and to be able to utilize a public resource, whether you're a child or elderly, student, whomever. It isn't limited to just meth. There are a great many other issues, and consider the fact that it was very brave of a 14-year-old girl to actually file a police report and to put her name out there at great risk. And so count how many, or try to count how many people don't file a report, who do feel threatened and simply leave, or are victimized and personalize it, internalize it, and suffer needlessly for extended periods of time. This is not something that we should take lightly. You asked some good questions, but I think there's a lot more questions that remain unanswered. One of which was, what happened to the guards who just quit? That's what I read in the media accounts. Guards are supposed to be present, making a difference, and yet it happened 7 times after my child was victimized. So, please keep an eye out and protect the more vulnerable among our community.
Thank you, John. And very sorry to hear that happened to your daughter. Now we have Joel Gascoigne, Chris Barge, and Evan Ravitz. Joel?
My husband signed up. Unfortunately, we were unable to get childcare for our 1.5-year-old after being randomly selected just yesterday. So I am sharing his letter.
Go ahead.
From Joel. Good evening, Council.
Speak into the mic, please.
Good evening, Council. Over the past 13 months, I've been witness to the city review process my wife has gone through for her new cafe. She's been paying rent on an empty space prominently on Pearl Street without the ability to do anything with it, her hands tied by Boulder City. It's frankly been completely demoralizing and has taken a significant financial and emotional toll on her. On slide 1, I believe he had submitted slides. It was a photo that somebody took that written on my space, Pharmaca was better. Anything, of course, providing a service to the community would be better than an empty space for over a year. The community is tired of seeing, I'm sorry, I think those are the incorrect slides. Can we pause as?
Sure.
I'm not sure what happened.
What was the name that you submitted the slides under?
His name is Joel Gascoigne.
Okay, and what's your name?
I'm Jess Lou. I'm his wife.
Okay, were those your slides that I just pulled up?
Yes.
Okay, he has separate slides. Did you get those?
We only got the ones from you.
Oh, I think he shared, he's told me he submitted them to the city clerk's folder.
Okay, we'll look for that.
We can get those sent to us later.
Okay. The community is tired of seeing empty spaces along Pearl Street. It does not reflect well on Boulder and is a waste of opportunities for the community to come together in various establishments. It should be the city's goal for our spaces to be fully utilized for the benefit of the community. Before my wife started the review process, when I saw these vacant spaces, I thought it was because we didn't have demand for new business here in Boulder. What I've now learned is that it's because of a broken city review process. Each review stage takes months, and the stated deadline is never met. On top of that, reviewers do not make themselves readily available to help. Most egregious of all, the review process is a moving target. Brand new issues are brought up out of the blue, having never come up in prior cycles, blocking the ability to move forward. There should be a goal to help businesses who are eager to fill these spaces and make meaningful contributions to Boulder, especially the small local businesses and those started by underrepresented people. These are the people who will bring about the most special contributions to Boulder. If the review process was designed with this in mind, the equity guidelines Councilwoman Joseph inquired about, it would be completely different. This is the type of reform I think is warranted. The current system skews the playing field towards chains and big brands. The past year has put significant strain on our family, and there's no doubt that most new small businesses cannot handle this process. It drains budgets and leads to those new businesses failing before they can even start. And when they fail, there's real damage caused to their lives. And we lose out on another small local business Boulder could have had. The community doesn't want Boulder to be taken over by big corporations, and yet Boulder's city processes are creating that outcome.
Thank you. Thanks. Now we have Chris Barge, Evan Ravitz, Travis Hugh Cully.
Good evening, everyone. Thank you for holding this forum about the situation in the library. And I just want to express my thanks for the frontline librarians and staff at the library who I see every day, frankly, doing work they shouldn't have to. I also want to say that what you've seen on display as far as your city staff's response to all of this has been true integrity and character on display, and is something I get to experience every day as I'm in the library. This unbreakable culture that has not just survived, but been able to help carry us through this pandemic by keeping one of our treasured resources and public spaces open isn't to be taken for granted. I come with a message of thanks. They've managed a tough situation for too long. It's not their job. I want to encourage the community to resist the temptation to conflate homelessness with drug use. And that said, I also want to say meth is a nasty, nasty problem. I used to be a reporter. One of the biggest stories I ever did was about meth. This was 20 years ago. And to hear that this is a scourge that is ticking up nationally, and to now see it here in our prominent public and civic use space, this is something that I'm really, really motivated with you. If we can partner with others to look at this holistically, meth is something that it can't belong in our community. And it's going to take something beyond a day shelter discussion. This is a specific problem. The drug use in our civic and public areas is going to require a separate and comprehensive plan with action behind it. So I appreciate the focus on, okay, what happened in the bathroom? Let's fix the bathroom. Let's look more holistically at what's happening in our public and civic space, and let's tackle this.
Yeah. Thank you, Chris.
Okay,
Appreciate
thanks.
that. Evan Ravitz, Travis Hugh Cully, and Jess Lou.
Evan Ravitz. I've spoken twice about the mayor betraying us after 5 years of saying he wanted legal camps for the homeless, like Denver has 8 of. When he finally got a progressive majority, instead they voted twice to spend millions on sweeps of the homeless, like trash. Aaron is merely one politician who has learned that betrayal has the biggest payoff in politics. Governor Polis famously betrayed anti-fracking folks when in 2014 he first sponsored and then killed a ballot initiative for 2,500-foot drilling setbacks. And Biden said he'd be the greatest labor champion since FDR, but actually prevented railway workers from getting sick days when he has unlimited sick days. He also betrayed his promises on asylum seekers, etc. That's why, for over a century, we've also had direct democracy, so that what you vote for is what you get. You're the third city council in a row to allow or encourage staff on behalf of behind-the-scenes dark money to obstruct each stage of our first-in-the-country online petitioning for direct democracy. That's 71% of voters put in the city charter over 4 years ago. But you've lost your war. The city of Taipei is now implementing online petitioning for direct democracy, from which it will spread. Boulder could have been seen as a beacon of democracy, instead will be a footnote in history. This hasn't been the People's Republic of Boulder since Penn Tate was mayor. He's spinning in his grave, knowing that his name is on this building.
Thanks, Evan. Now we have Travis Hucully and Jess Liu.
Good evening, Council. As to the shuffling of committee assignments on December 15th, respectfully, the decision you come to in filling Tara Weiner's seat as the Boulder Director of the Rocky Flats Stewardship Council is consequential. In 2024, the IGA that establishes the RF-LMA contract with the DOE will be re-signed and continued for another 3 years, protecting the Rocky Flats Stewardship Council from 2024 to 2027, perhaps even longer, unless a deficit of votes are found to continue the Stewardship Council contract this year. It is appalling to me, but in light of last year's fire, this Stewardship Council is a tabula rasa. It has nothing to say, it contributes nothing to the Boulder County health or safety safety management in the area. Coloradoans need to think differently about the way forward in Region 8. Therefore, with Boulder County's Rocky Flats directorship comes an opportunity to answer the question of why we cannot have a comprehensive fire plan for the entire region. Decommissioning this group will have to come from within. That'll be an inside job. Thank you very much. We love you, Lynn. Thank you.
Thanks, Travis. Jess Liu.
Good evening, Mayor, Council. I'm disappointed and frankly frustrated I feel the need and responsibility to speak tonight. Now, 13 months since I began the city's review process, my building permit, timeline on the first slide, is still not approved due to a new reason introduced at the end of last year. The constantly changing goalposts are yet another example of how the planning and development process ultimately suppresses and financially devastates small business owners like myself. When I spoke at council last, it was noted I had a meeting scheduled with building officials Edward Stafford and Kirk Moores. For that meeting, my architect obtained an official ICC code opinion at staff's request to resolve a difference in code interpretation between my architect and Kirk. The ICC opinion came back in favor of my architect's interpretation, overturning Kirk's, which the final comment blocking my permit rested upon. As next steps, we were provided guidance on the final revisions required for my permit to be issued. We submitted our revised plan on December 13th, and on December 20th, Edward called my architect to inform her that our revised plan successfully resolved the single outstanding comment. However, there was now a new issue, a local amendment that had been overlooked until then that was now blocking my permit issuance. How, after multiple review cycles and meetings over the course of 6 months, was a local amendment not mentioned until the 11th hour? Is this truly an instance of oversight and job incompetence? Or is this something else, something worse? Just as I'm arriving at the finish line of a 13-month marathon, mind you, a new obstacle is added, and the finish line's been pushed back yet again. It feels like PNDS finds ways to impede progress, a sentiment I've heard from other business owners in Boulder. Contrast to the great experience I had working with the licensing department for my beer and wine license, slide 2, the whole process from application submission to approval took 3.5 months. Posted that deadlines are adhered to, requirements are clear and do not change, and the staff make themselves readily available. I share my positive experience because it's important to recognize departments that are working. Planning and development services is not one of those. The process is nothing short of prohibitive, and critical small businesses, minority and women-owned businesses like mine, will continue to be casualties on the process until process is reformed. Thank you.
Thank you, Jess. All right, we're going to go to our remote speakers now. Number 2, I understand, is not present, Ryan Harwood. So our first 3 will be Doug Hamilton, Claire Kelly, and Jenna McAfee.
Okay. Can you hear me?
Yes.
Okay, great. Hi, my name's Doug Hamilton. You probably all know me. I was a Boulder Library champion and also co-chair of the campaign that created the library district. Thank you so much for taking this issue with the library serious, as it is a serious issue. And as you know, or probably should know, that the status quo is not working. The problems that happened at the library are probably happening in every space or every type of space in Boulder, public and private. We could be looking at a private business that gets shut down because people were using drugs in the bathroom. If we want to, we need to start looking at solutions that address the systematic problems that cause drug addiction and trauma. And we need to propose solutions that put people and the environment first, above, profits and property values. Without that, I don't think we're going to move the needle on this issue. We need to treat every solution as a prototype, and everything that we're doing as a prototype. We don't need long, drawn-out study sessions. We need to get solutions implemented quickly, and just know that sometimes some of those solutions are going to fail, and we just need to experiment with it. And it's okay. We might fail, and that's okay. But I think if, I'm here to support you in, things that don't necessarily work, because your heart's in the right place, and we're trying to make our city safe for everyone. Thank you.
Thank you, Doug. Now we have Claire Kelly, Jenna McAfee, and Sherry Hack.
Hello. I just want to first and foremost give a vote of confidence to our Boulder Public Library staff, to our library director, his managers, and frontline workers who serve the public every day in the library. And I appreciate how they have guidelines and rules to keep our library a safe space for people like me and my young kids. And I see that happening with how the situation is being dealt with, and I'm looking forward to coming back regularly to the main branch with my family. I think, however, this is an especially difficult situation. We all acknowledge that. And we need recognition that this should really be a city social service issue. It shouldn't really be a library problem. It's a symptom, unfortunately, of addiction nationwide, which is well documented. If anyone's not familiar, I recommend you read the book Empire of Pain by Patrick Radkeefe about the origins and impact of the opioid crisis and its relationship to meth. I hope our city leaders can plan a larger discussion about these systemic issues of drug addiction and use in public spaces in Boulder. But really, one of the best things about libraries is that they are public spaces. They are democratic spaces. They provide access to information for all. That's their mission and purpose. And that's why they're so valuable in our society and in our city. And as public space, there are a wide variety of people who have access, and unresolved issues in our city will present themselves. The library currently has a good working relationship with the police when a security guard issue needs to be escalated at the library, but our library workers are not experts in dealing with drug use or environmental contamination, and I feel strongly that part of the resolution of this issue is that librarians should not be expected to play that role. I've read their plans to open a day shelter, which certainly would be a great development for our city and something that has been needed for a long time, but a day shelter that serves the unhoused will not tolerate drug use. So it doesn't really solve this problem. I saw a council member said in the Daily Camera this would be a problem for the new library district 12, and I don't think that's fair to pin it on an entity that doesn't even exist yet. It will be only a problem if the city and county doesn't take action now. Thank you.
Thank you, Claire.
Mayor Brackett, I have a question.
Yes, go ahead.
For Claire, if you're still there and can hear me, would you mind sending us the book recommendation that you just gave? Emailing? Well, out to the ethers if you no longer have an ability to unmute. That would be
Yes,
great.
I'd love
Oh, there
to
it is.
send it to you.
Thank you.
Empire of Pain, Patrick O'Keefe. Thanks.
Thank you.
Great. Now we have Jenna McAfee, Sherry Hack, and Sharon Procopio.
Hi, this is Jenna McAfee. I'm also here to talk about the library issue. And as a person who really loves our library system, I'm thankful for the library staff who perform their services every day in the midst of very challenging circumstances. Library staff may be among the most visible city staff in the downtown area on a daily basis. And I am sorry that they have to constantly be on the front lines of a growing issue that is devastating communities across the country. The majority of people using our downtown library are using it for its intended purpose and getting tons of benefit and joy from it, like me. For the very small number of visitors who have been abusing the library, I am upset. I don't want library services impacted by that small group of people. But I also don't want city policy being impacted by a small group of people who consistently portray Boulder, and lately the library, as dangerous and crime-ridden. We can't effectively govern or make policy from a place of fear and mistrust. I also think we owe it to the library, whose staff work right in the middle of the civic area every single day, to have a serious discussion about how to make the downtown area accessible and safe for everyone. And this policy should be rooted in humane and proven harm reduction approaches. Thank you.
Thank you, Jenna. Now we have Sherry Hack, Sharon Procopio, and Riley Mancuso.
We have a public health emergency in Boulder. Our indoor public spaces are being contaminated with meth. We have our main library debacle, which is being reported in the national press. The community has complained for a very long time about the drug use at the library. In the last 3 years, there have been 1,499 reported incidents at the main library. 39% of those were in 2022 alone. Incidents such as drug use, assault, harassment, indecent exposure, criminal mischief, weapons, fires, etc. There are 2 police reports of drug use on 12/23 at both the East Boulder Rec Center and the Boulder Homeless Shelter, and meth was found in the shower at the homeless shelter. According to the Colorado Department of Health and Public Environment, even one instance of meth smoking in a building warrants specialized testing, and a strict protocol must be followed for that testing and any mitigation. Do you know that smoking meth can contaminate a building more than manufacturing it? Why are the East Boulder Rec Center and the Boulder Homeless Shelter not being tested for contamination? Because city officials decided that just one instance of meth smoking inside the rec center doesn't warrant testing. This is false. Also, how does the city know there was only one instance? The patrons of the homeless shelter and the rec center deserve better than this by a city with a $500 billion annual budget. The Boulder Works government website encourages illegal drug use in public bathrooms. It gives detailed instructions on how to use illegal drugs in public restrooms and not be discovered. This isn't harm reduction, it's harm promotion. And not testing the Boulder Homeless Shelter and the East Boulder Rec Center for meth contamination is also harm promotion by the city. Oh, were you able to hear me?
Yes, we can hear you.
Oh, sorry. I urge you to implement the same security measures now in the branch libraries that are planned for the main library. We need to be proactive and not reactive. Thank you.
Thanks, Sherry. Now we have Sharon Procopio, Riley Mancuso, and Sam Jones.
Hi, everyone. Can you hear me?
Yes.
This is Sharon Procopio. I live here in Boulder. I also happen to do a lot of engineering in town, so I'm very familiar with the library and a lot of our community issues. And I wanted to speak similar to others, just to chime in support of the library during this difficult issue. Actually, today, my favorite thing online, posting my son's favorite books and getting recommendations from the library, was another successful set of recommendations from the librarians. So I always appreciate, even if we can't be there in person, how helpful the library staff are. This issue is something that I think we all recognize as a community-wide issue. I think several people and on council have noted this is not a library issue, but it is kind of falling on the library to handle these problems, given the fact that we don't have enough resources elsewhere. I've heard the day's shelter mentioned, and it's true. I think that would be a helpful aspect, but as a community, I think we have to work towards those solutions. Several other people have already said that as well, so I don't want to be redundant. But I do think there are some opportunities for the community. So for everyone speaking out with concerns, there is an innovation and design homeless solutions group for Boulder County being run that I'm a part of. And I think they were having trouble with engagement and are going to go out for additional requests for support. And I hope to see the people who are concerned for this issue sign up to engage with this group and other groups in the community that are working to solve it, so we can address this issue as a community. And I look forward to working with everyone to see our city grow and thrive and address this together. Thank you.
Thank you, Sharon. I understand Sam Jones is not present, so our next three people are Riley Mancuso, Aiden Reed, and Rachel Daly.
So my name is Riley Mancuso. I am a regular user of the Boulder library system, and I work in substance use treatment. I am calling in today to say that if the question at hand is how do we prevent meth use in the library bathrooms, then the only answer is to provide people with safer places to use methamphetamines. One thing I know, and what is known by every single major drug treatment and harm reduction program in the world, is that you cannot force people into treatment. Another thing that I know is that people do not prefer to use drugs in public bathrooms. If your best place to use a drug is in a public bathroom, you're having a pretty shit day and most likely a pretty shit life. I want to point out that when people use methamphetamine in tents, they are causing harm to no one but themselves, and yet methamphetamine contamination is used as justification for police taking people's tents and worldly possessions and throwing them directly into dump trucks. We have this on video. It was done by the CertPro contractors. It's done by city workers now, and it costs millions of dollars to commit theft of people's worldly possessions. And you do this and wonder why anybody would smoke in the bathroom. But I also want to fight the idea that this is only a problem caused by unhoused individuals. It is caused by our society's general criminalization and moralistic judgment of substance use, which is not morally wrong, and when it becomes a disorder, is a medical phenomenon. That's really all I wanted to say. So please don't listen to the bigots who are.
Your time's up, Riley. Thank you. Now we have Aiden Reed, Rachel Daly, and Eric Budd is not present, so then Alexis Howell.
Good evening, Council. Are you able to hear me?
Yes.
Good evening. My name is Aiden Reed. Thank you to the library staff for all your work. I'd like to caution the Council against a punitive response to this incident. And while I understand the impulse, I think that it's important to avoid a push to continue to criminalize homelessness. Already, homelessness is criminalized in Boulder, and criminalizing it does not actually reduce the risks that come with it, nor does it reform the conditions that created it in the first place. We know that substance misuse, mental illness, and housing insecurity are interlinked, and our response should reflect that. A punitive response isn't sufficient because It will displace crime rather than reduce it. A rotating cycle of incarceration and subsequent release back into the same conditions that created substance misuse in the first place isn't a sustainable model of public health, nor is it a sustainable model of public security. What is required instead are comprehensive wraparound services and sustained funding. And I hope that instead of pushing to continue to sweep homeless camps and make it illegal to camp in general, the council will consider ways to ameliorate the conditions that create homelessness and substance misuse in the first place. The council has the power to set the priorities for Boulder, and I hope you will consider what public health measures are actually effective and make Boulder a safer, more pleasant community for all. Thank you.
Thank you, Aiden. Now we have Rachel Daly, Alexis Howell, and Nicole Perelman.
As someone who loves this library, loves the staff who work there, and who has benefited enormously from the library as a mother and a resident, I want to say thank you to the city and the library for working through this incident swiftly and for taking action to fix and remediate the building space so that it can reopen safely again. I also want to commend our librarians for regularly handling difficult incidents and problem behaviors from the public. Now, the city faces a much more complex and wide-reaching problem that led us here. I'm glad to see the City Council taking leadership and accountability and looking at this incident as a symptom of a larger issue for the region. Thank you to the Council in advance for giving our libraries the necessary support in dealing with this specific issue and for protecting these spaces for everyone, including staff, so that we can all get back to enjoying one of Boulder's most loved community spaces.
Howell, Nicole Perelman, and Matthew Reynolds, and then a couple of people have showed up who weren't present previously, so we'll get to them next after those. So Alexis.
Hi, I just want to echo what a lot of other folks have said on the topic of sort of responding to methamphetamine use in the library, and echo that I would discourage the city from adopting a punitive response, as another speaker said. There's been a lot of discussion of focusing on security and enforcement in the context of the library in response to this issue. And the reality is that because, as many elders have said, this is not just a library issue, enforcement will not fix this, right? Enforcement drives people further to the margins of society and makes them increasingly desperate. And rather than using meth in places that are safer for them and for others, to the extent that it's safe to use meth at all, but that it's safer for them and for others, they end up using them in places like the library bathroom. And increased enforcement in response to this is going to drive people to find other places that are going to probably be even less safe for them and the community. So if we really want to address this, what we need are services. We need safe use sites. We need free and voluntary addiction treatment programs provided unconditionally. And I think most importantly, we need services that people actually want to use. If we look to homeless services in the city as an example, I know from speaking with unhoused folks living on the streets that many people don't want to use those services that are available to them because they feel that they have to completely surrender their personal autonomy in order to do so. And for many people, that's too high of a price to pay to access those services. And if the city introduces addiction services that have that same problem, we're going to see similar failures in that case. So I would really encourage the city to keep all of these things in mind when working to address these problems, because again, you cannot criminalize drug use out of existence. It is, again, as many have said, a public health issue first and foremost. Thank you.
Thank you, Alexis. Now we have Nicole Perelman, Matthew Reynolds, and Ryan Harwood.
Nicole, your mic is open.
Let's see, maybe we should come back to Nicole at the end.
All right.
So Matthew Reynolds, Ryan Harwood, Sam Jones.
Looks like Matthew Reynolds is not in the meeting. We'll go to Ryan Harwood.
Very good.
Nope, does not look like is in the meeting either. Let's move next to...
Get Sam Jones, then Eric Budd.
Not seeing Sam Jones here either. Let's try Eric Budd. All right, Eric Budd.
Thank you, Council. Eric Budd, I live in Boulder. I also wanted to speak on the library tonight. I really appreciate both city library staff as well as the City Council for talking about this tonight. I've just been following the local reporting on this and, really from the New York Times, which I thought was relevant, which said, quote, Boulder County said there had been a sharp increase in the number of methamphetamine-related properties, places where the drug is manufactured or used in the county over the past 6 years. And that rise mirrors the drug overdose crisis that many communities around the country are struggling to contain. And so, we're all disappointed that the library closed temporarily, and we all know that that's not acceptable. And we know that that really the question is, what do we do about this? I appreciate the remediation efforts and that the public space is being able to be opened, but going forward, I would really like to see the City Council address root causes here. That we need a day shelter for people experiencing homelessness, and that people have services for people experiencing addiction. And what's not helpful, which is the further criminalization of people suffering from addiction and homelessness. That's not helpful. Posting police officers in our library is not helpful and has some seriously harmful effects to marginalized communities. So it sounds like this closure was out of an abundance of caution, and that further investigation found no additional contamination. And the officials running our library should be commended for quickly moving to address this problem. And so I hope Council is thoughtful in ways to address the root causes of these problems in the future. Thank you.
Thanks, Eric. I understand Ryan Harwood is back in the meeting. Can we go to Ryan, please?
Hello, Council. I want to congratulate you on the sweeping success that the tent ban has been. Not only are homeless deaths up 41% this year, but you also managed to get the library shut down too. Now, when the tent ban was being proposed, I distinctly remember Chief Harold saying the police department needed the ability to steal people's tents on site because people were using drugs in them. I wonder where those drug users went. It is such a mystery to me. If the past 50 years of drug policy tells us anything, criminalizing drug users makes them stop using drugs. I'm being sarcastic, of course. The war on drugs has resulted in massive increases in drug use, and Boulder is no exception. Look, you took people's tents away so homeowners wouldn't have to see poverty, and a subset of those people use meth. Those people found the next best secluded place to use, the library bathroom. It's really that simple. I'm not making excuses for anyone. It sucks that the library is closed, but people are going to use drugs. Most of the people making comment tonight use drugs. The difference is we have homes to use our drugs in. Almost people don't, so they're going to find the next best thing. Now, you're going to have a bunch of people here talking about how we should do more of what caused the library to shut down in response to the library getting shut down. More criminalization, more cops, harder punishments, and so on and so on. I'm sure the war on drugs will work this time. Here's the deal. People are going to use drugs whether you like it or not. Safe use sites and decriminalization are what keep our public spaces drug-free. You can either listen to decades of evidence and all the experts in addiction and homelessness, or you can listen to the people who want to make a Guantanamo Bay for homeless people. The choice is yours.
Thanks, Ryan. Let's see if we can get Nicole Perelman this time.
Nicole, your mic is open. know Nicole was having some technical issues earlier. We tried to resolve it, Nicole. We still do not hear you.
So, Nicole, sorry it's not working out. I encourage you to send us an email with your thoughts. And I believe that is the last person who signed up and was present in the meeting. So we'll bring open comment to a close, and I'll turn to staff to see if there are any responses to any of the open comments.
I think we just had one. David Farnan would like to address some of the speakers related to the library.
Yeah, I would just the opportunity. So we'd have to check with Chief Harold. I believe the data shared on the number of calls to the public library. The public library address is given out for all kinds of calls downtown and to the public service to the park. So they list the address, including areas under the library and encampments and a lot of different other things. So I don't know the exact number. I believe I have memory of 6 actions of sexual deviancy in the library in the past 10 years. I know of 2 this year, and I do not want to in any way have this construed as disparaging. I am a parent as well. This is a very serious offense. The police also filed a police report in that instance. I mean, we take everything seriously. We captured surveillance cameras and identified 2 people who we thought were suspects. We shared that with PD. They were able to identify an individual. They gave us the name of that individual, and I believe sought him out. I do not know if they made contact. My staff took that name, and I know for a fact that that person has at least 5 convictions of indecent public exposure. I have stayed in touch this entire time with the officer who opened that case. That gentleman came back into the libraries probably 2 months after the incident, which was reported to you this evening. He was again, this time witnessed by an adult male who agreed to testify and to give his number. I shared that number with PD. I do not know if PD was ever able to make contact with this individual. I know that we suspended him for 364 days. I know that only a few weeks ago he walked into a different library within the Boulder Public Library system. My staff immediately identified him from us having shared his photo and expressed the seriousness of someone in our library who is a sexual deviant, and they immediately called the police. That person again fled. I do not know if the police have ever made contact with the individual. I think they did initially in order to identify who he was. I am unsure where he lives. I don't have any of that information, but I assure you, I have the officer, the case manager, the number on my desk, and I remain in contact with that case manager of that case to this day. I mean, I sent him email 2 weeks ago when this gentleman walked into one of our other libraries. He had no offense, but he is trespassed currently from the library for 364 days. I'm unaware if he has been arrested or convicted of any crime in the city of Boulder.
Okay, so thanks for that.
David, and the number of incidents which were reported in 2 different things, I'm quite certain that is not true. I think I will have to check with Chief Harold. I believe they report a lot of calls to the downtown area, to the park, to the civic area as the library
Maybe you all
does.
could follow up on that.
I will.
It would be helpful
I
to know
definitely
the
will.
calls that were issued for the library itself, the building
I
itself.
definitely
Yeah. Council. So I've got Rachel, Matt, Tara.
I have a couple. I mean, it's been a while since we heard from the public, so thank you all for being here, and we probably all have a lot of questions. So first is on Jess, who testified twice this situation. I think it would be helpful. We hear this so often that it's hard to get through planning department services, and it's hard to get through to someone, and it's clunky and costing people money, and the sort of bigger actors can get through it, but the mom and pops can't. So can we get another update on how we really, I think, need to improve the whole system, and somebody shouldn't have to come to council once, let alone twice, to get through the hoops. So an update on that would be great. On her situation, as well as the whole, what are we doing to make it usable?
Yeah, Brad Miller, our Director of Planning and Development Services, is here.
Hi, good evening, Council. Brad Mueller, Director of Planning and Development Services. Sorry to duplicate. 2 things, just wanting to address the specific case and then the more general comment that you speak to, Councilman Friend. After Ms. Liu spoke this last time a couple months ago, she, as she noted, already had a meeting in place with our staff, and we followed through on trying to process a building permit. We did make a mistake in that case in not flagging something early, and that has that has been followed up from a personnel standpoint. But we've acknowledged that and then advised her of the regulation for sprinklering in this case. But at the same time, certainly I asked staff to dig deeper into, creative possibilities, and this week we've been able to do that. And as I reported in my meeting with her this afternoon for a couple hours, we anticipate that we're going to be able to release that tomorrow. And I'll be happy to provide counsel the written background and all that for kind of the specifics of that case, and which represents really the nuance that's true of many cases. To the larger issue.
Can I just flag before we move on? She's got
Sure.
her hand up in the back. I don't think people can come and speak, but
Yeah, I'll just say, Ms. Apologies, we don't have a back and forth opportunity, but maybe you could chat with Brad one-on-one after this interaction is done.
And I will say Bob and I have office hours as well. You're welcome to come speak to us.
Can follow up with an email as well.
Yeah. Communication with the office. As you may recall, the service hub was opened last spring. This is the in-person site that we have open at the New Britain building from 10 o'clock till 4 o'clock Monday through Friday. We have received feedback as that ramped up that people were not aware of that. So we will redouble our efforts to kind of make sure that word gets out. Appreciated actually the suggestions from Ms. Liu this afternoon about how we can put that on people's emails and some things like that. We do, it is a big culture shift because literally for decades, there was a common counter for in real-time use of specialist, subject matter specialist. That was very expensive. And so now we have an appointment-based kind of situation where people can come in to get routing and direction on information, but then make appointments as well. But we acknowledge that that's an area of communication that we need to do better. And just even in the last month, I've heard about that. Again, these are the steps we need to do in kind of shifting the culture that went all virtual suddenly for 2 years and now is coming back out of that. And we know we can do better, and we've got steps in place, and I'll be happy to provide some details about that to council as well.
Appreciate you hitting the ground running as the new planning director here. So thank you for that.
Trying. Thanks.
Fine with me.
Yeah, go ahead.
So let's say that she, I always forget that. So the last problem was the fault, I guess, of the employee, that they overlooked something, right? The sprinkler?
Yes, yes.
So let's say that she is again losing some more money on this employee. Who pays for that amount of money? It's just she has to pay for the city's mistake?
We are working out how to refund the parts that we can, which is the fees for service and those types of things. And there are limitations on being able to refund, for example, sales tax and development impact fees and those types of things, council members.
Plus rent, right? I would assume you have to pay rent while you're waiting for your approval?
If a person's made that contribution, but I would defer to the attorney's office for those kind of analysis.
The city is not liable for the time that the regulatory process takes unless there's a prescribed time period and we violate that time period and we're found liable. Here, there is a suggested time period that can be extended. And so it's simply not a liability that the city incurs.
Well, I just have to agree with her that I cannot even believe it's over a year and she still hasn't been able to get that approval. It must cost a huge amount of money, and it really is true that if we're trying to get local businesses to be successful, how is that going to happen under these circumstances? When I walk down Pearl Street in West Pearl, there are so many for lease signs, and likewise, I'm like, oh, I guess we can't lease these. Maybe that's not even true. Maybe we just can't get the approvals.
Yeah, I understand your point, and certainly we have an obligation and a commitment to streamline the process. That's a project that was started, I think I've described to council before, a couple years ago before I started, and is being implemented. Really resulted actually in the development of the department being formed 2.5 years ago. To speak to any individual permit or generalize about a time frame is difficult because some permits can take years if there are things that are not being addressed or if it's simply goes dormant. So I'm always reluctant to try to say that a particular time frame is accurate or not accurate given or meaningful based on specific circumstances. But as I've talked with most, if not all of you, certainly there's been anecdotal evidence, and we've also have our performance metrics that show that those turnaround times are not what our performance indicators and goals are. I think I've shared with you more recently too that particularly in our plan review, we're not making our performance goals, and we've been taking steps, including hiring contractor help a couple months ago to help us get to that point. I've got a meeting with that group, Safe Belt, here in the next couple of weeks just to reinforce our need and double down on their services as well.
I'm sorry if I sounded mad. I know you're awesome.
No, I appreciate your frustration. We're frustrated that we can't do better all the time as well.
I trust that you're gonna take care of this and make it better. I do.
Thank you.
Thanks. And I have one more.
No, well, you're still pointing.
Oh my gosh!
Yeah. I almost cut you off there a minute ago, so I'm going to go real quick through a couple of things. One is to Chris. There was a question about the East Rec Center having a meth smoking incident. Did we have a meth smoking incident discovered at the East Boulder Rec Center?
I have heard that there's a copy of a police report that is circulated around on an incident that occurred the evening of December 23rd, which is when we were conducting sheltering operations at the East Boulder Rec Center and Community Center. That police report specifically references an individual who was found that had a blue pill on tinfoil, which typically is associated with fentanyl, not methamphetamine.
So remediation not happening there because it wasn't discovered to be meth. Is that accurate?
I think Allie knows about this, and I do see she's in the meeting. Allie Rhodes, I wonder if I could invite you to turn on your camera, turn on your audio to address this.
Good evening, Mayor, members of council. Allie Rhodes, Director of Parks and Recreation, and Chris has the facts accurate. There was an incident the evening of December 23rd. The police were called and an individual was arrested, and we have confirmed with PD after some community questions that this was not a methamphetamine related incident.
Thanks, Sally. Next question. There was someone mentioned we should be cleaning the homeless shelter. We don't operate the homeless shelter, correct?
That is correct.
And then my last question is several speakers mentioned or sort of emphasized public health aspects and needed responses to the meth epidemic. Obviously, we aren't public health, that's the county. So are we in communications with the county about what they're planning to do in response to what is clearly a growing epidemic?
Yeah, we've had continued conversations with Boulder County Public Health, and I think as Nuria mentioned at the top of the meeting, that broader conversation is one that we are working to schedule.
And they can speak with us as well on that at some point?
Yeah, that's
a good conversation.
That's the idea, is how do we start to frame that conversation in a way that gets the right folks in the room.
Thanks for bearing with all my questions.
Right. I've got a bunch of people queued up. Let's try to be brisk with the questions because it's getting late. I got Matt, Tara, Nicole, Mark. Okay, you're good. And then, so, Tara.
I know, oops, that was my stool. I'm having a fun night here. I know, John, that you wanted to say something as well, and we don't have the back and forth, so if you want to contact us in email, that would be good. Okay.
Good. Nicole?
Thanks. Just two relatively quick things. One of them, I'm not sure actually if anybody can answer this because I think it's more of a county thing, but I will just ask it in just a quick yes or no if we do or do not have the information for it. One of the speakers mentioned that the Boulder County Works website tells people to use public restrooms to use drugs. I know that's a county program, but can anybody confirm that?
Nicole, I don't have any information on that, but we can
Okay.
follow up.
We can look into
Okay,
it, get back to her.
Yeah.
Okay.
And then I think the other question, this is one for David. And David, I don't need a long answer here because I know we are getting late, but just, any quick things that you can say here. I heard some of the concerns about what increased security would look like as the library reopens. And I'm just wondering, how will we keep the library a welcoming space? What are your plans? I mean, I know it's one of the most welcoming places in our community. And, will the security be armed? How will we avoid profiling people with this added security?
Yeah, we have no, I mean, the Library Commission removed armed guards from the library years ago as a response to public outcry. We have no intention of bringing armed guards back. The increased guards that we are intending to hire, Nicole, are essentially bathroom monitors. I don't know that they'll be, there are questions about uniforms and that kind of thing, or whether they wear a polo shirt. I don't really know. We've never hired them before, but we're going to be hiring a type of guard that can actually make judgments based upon someone's health condition and be able to allow people into the bathrooms on a regulated basis.
Okay.
Thank you.
Mark? And then Lauren.
Thank you, Mayor. Just a couple of quick questions. Brad, come on down. You're on the hot seat today. Did I hear correctly that Ms. Liu's permit is now ready to go, or?
We are very close to thinking it'll be ready to go. So very detailed analysis that allowed us to find a way to not require sprinklering. And that analysis is being written up by Edward. It's taken him a little while. He's got bronchitis right now. So we anticipate that given to her architect, the architect will be satisfied with that. We'll get the final plans and then be able to release it.
How large is that space in square feet?
I want to say 1,600 square feet, if I remember. There we go.
13 months for. Okay. 13 months for 1,600 square feet seems.
Yeah.
A little out of line.
So 6 months of that was a zoning review. It required a minor modification that my understanding is the building owner was not aware of. And then after that, we started the review. A couple months into that is when, that was the dead of the summer when some of those things that I alerted to in terms of service delivery were happening. We subsequently found about the fire sprinkler issue a couple months then to entertain a potential analysis from the National Code folks. And then the last month or so working through a creative alternative to that.
And my last question is, how long did it take the Macy's developers to get their permits? Which is really a way of asking, are we treating large spaces and large developers differently, with a different level of priority than small businesses? And is that appropriate?
Well, it isn't appropriate, and I feel confident that we are not doing that. We did do some analysis when you all asked us that question, I think a couple months ago, and I'd be happy to provide that again. To the best of our knowledge and looking at the metrics and such, there is no systemic treatment of large versus small. Now, is it possible that larger groups can turn around, have consultants who can turn things around quicker? Possibly. Larger cases take longer for us to review too, but we weren't able to identify anything that was systemic in that regard.
Okay. Thanks, and I think we need to do better on a 1,600 square foot space.
Agreed.
Okay, thank you.
And I'll just say, Brad, I appreciate the answers to the questions. I do hear that you all know that there's work to be done here, and I know it's on your to-do list to continue to improve on that.
Top of the to-do.
Absolutely. Yeah. All right, Lauren, then Jeannie.
Wait, Brad, don't sit down. I appreciate the answers that you've brought forward, but I would like to know sort of more about what triggered this minor mod
the 6-month review for this smaller space that the building owner was potentially unaware of, as well as what you mentioned, some streamlining. I think we could use some more detail on what that looks like, as well as what permitting times are. And, I'm going to sort of harp on the same thing that I've been bringing up before, which is, are we really staffed enough to bring forward these projects and, to go through permit process in a timely manner while also doing the work that we as council have on our work plan? I know that those aren't necessarily overlapping positions, but
sure,
they're, both very important, I think, to this council.
Oh, just to speak to the one piece of, a department that's got many different kind of permitting things, the plan review, we are not staffed enough. And we've been trying to hire a position now for some time. We've been trying to hire a chief building official, which I've shared with you all our really disappointing failure on having thought we filled that and then didn't. Council was very supportive in giving us another position for a plans review expert, and we are actively and aggressively trying to fill that, but with limited success, which is why we've hired Safe Built some months ago. They have made a dent, but it's been more of a plateau than an improvement. That's why I'm meeting with them to see how we then take it up the next notch to keep improving. Of course, part of that was their becoming familiar with our systems and all those types of things as well. And I say none of that to make an excuse. That's just the environment we've been working in, and we're working hard to improve it.
Thank you.
Thank you.
Junie.
I don't necessarily have a question. I just find this whole conversation a bit frustrating as well. The fact that Miss Louise been coming here over and over again over the same issue. And I can say, Brad, I know you're doing a good job and you're trying your best, but I just feel like you're not answering the questions. You mentioned that staff is sick, and I understand that, but again, this is a small business owner who's trying to get her business off the ground, and I don't think it's fair to just say staff is sick. I think you have to do your best to overcome those challenges, and tonight I didn't hear that, and I'm frustrated for her coming here again. It's been several months since she's been coming here discussing the same issue, and it should not be happening again. It's a small business. We have to do better by our small businesses. Thank you.
So, Chris, maybe you could.
Yeah, I'd love to jump in here and just appreciate the concern that council members are raising, and really also thank Brad for addressing the questions and trying to be as open and clear as possible. And I think Brad's been clear that his team has been working and focused on improvements in service delivery, and the experience that the department is having in some of their service delivery, they know is not meeting the standard, but they're working day in and day out. Brad and I have had regular communication on the efforts that they are doing to continue to work to improve their services. So I just want to thank Brad for the work that they are doing, and know that and emphasize to council and the community that this is an area that we are focused on.
It's good to hear.
I have something else to say. I hear what you're saying, but Brad has not been clear, because I was not clear. Because he mentioned that he's still working on it. This community member has been coming here, right? And we still don't know as of today when the approval process will go through.
Yeah, and I apologize to the degree that hasn't been clear. Some of it is just detail that I don't have at my fingertips, and I'm very happy to provide that in writing to council.
Thank you. That'd be helpful, Brad. Maybe tomorrow we could get some additional detail. Okay. That brings us to the end of open comment. So we're now going to move on and I'll just point out it is 8:15. We still have two substantive matters to get through, so we'll try to be efficient from here on. Try to be efficient going forward. Okay, so we got a consent agenda items. Elisha, if you could take us into that, please.
Yes, sir. Thank you. Tonight's consent agenda is item 3 on the agenda, and it consists of items A through E.
Do we have any questions or comments on the consent agenda? Seeing none, perhaps a motion?
I'll do it. I move passage of the consent agenda, items A through E.
Second.
Okay, we've got a motion and a second. This is a show of hands vote, so all in favor, please raise your hand. Okay, that's unanimous. The consent agenda passes unanimously. Very good. We've got, now it's time for our call-ups. Yes,
Mayor
Chris.
Brockett, I think there's just one clarification. There was one item in the consent agenda, item 3E, which is the committee appointments for council. I think we had an error when we produced those materials on one of the committee assignments for the Rocky Flats Stewardship Council. We listed that as vacant, and I think Councilman Winder is going to continue to serve on that committee.
You have our deep gratitude, Tara, for continuing to serve on that. So perhaps, Mark, you might amend your motion to include that alteration.
I am amending my motion to include passage of 3E to reflect the continuation of Tara Weiner with respect to Rocky Flats.
Rachel, you want to accept that? Or no, this Lauren did that. Okay, good. Yeah. Let's do it again. All in favor? As amended. Okay, still unanimous. Thanks for pointing that out, Chris. All right, we've got a few call-up check-ins.
Yes, sir. Our call-up check-ins are item 4 on tonight's agenda. 4A is the concept plan review and comment for proposed redevelopment at 2801 J Road to include 84 for-sale dwelling units ranging from 1,050 square feet to 1,800 square feet, consisting of townhome, duplex, and triplex housing types. The plan proposes 40%, that is 34 middle income and affordable units. The percent of affordable housing community benefit will be finalized through annexation. This is reviewed under case number LUR 2022-00038.
Very good. And I believe we're going to have a very short presentation on that. Do I have that right?
Yes. That's right. Let me pull that up for you real briefly here. You can see that.
Great. And Shannon, if you could just introduce yourself, please.
Yes. Hi, good evening, Council. My name is Shannon Mueller. I'm the project case manager with the Planning and Development Services Department. So I'll just give you a real quick overview of this call-up consideration item at 2801J. So the purpose of the concept plan is to review and discuss a development proposal and identify key issues in advance of more detailed submittals. So the applicant receives comments from the planning board, staff, and the public, and city council if you choose to call up the item. The planning board held a public hearing on this item on December 6th. This proposal is in unincorporated Boulder County, northeast of the intersection of 28th and J Road. It's immediately east of city limits, and the 4.58 acre site contains the existing City Church Boulder building. The subject property is in Area 2 of the BVCP, which is the area under county jurisdiction where annexation can be considered. And the underlying BVCP land use designation is public, which reflects the current religious assembly use. The proposal would involve a request to change the land use map designation. Since the property is currently located in unincorporated Boulder County, the request would require annexation and for the property to be zoned to a city zoning district. The proposal consists of 84 dwelling units on fee simple lots in townhome, duplex, and triplex configurations, and it would include 34 for-sale middle income permanently affordable units in this area. This slide lists the overall review processes that the proposal would need to go through. And at the planning board hearing on December 6th, the board provided helpful feedback on several key issues, including the proposed land use designation, initial zoning, compatibility with the surrounding area, and general feedback on the proposal. The applicant shared that they do have a desire for council to call up this item, the eventual annexation, initial zoning, and the land use map change requests that the proposal requires would eventually need to be decided by the council. So calling up the item at this stage would allow for council to provide feedback prior to those detailed submittals being prepared. If council chose to call up the item, a public hearing would be scheduled at an upcoming meeting. And the applicant is here tonight and happy to share more about that request or answer any questions.
Thanks, Shannon. That was very brisk and efficient. Appreciate that. Any questions or interest in calling this one up? Rachel?
I think since the applicant asked us to call it up, I am inclined to call it up. I also just want to clarify, is it at call up or right now that we would need to invite like others, transportation tab to look at it?
Teresa, do you want to address that?
Yes, it's been the practice of council, and I believe code suggests that if the council wants to call this item up and it wants to refer to TAB or the design
advisory
board, thank you for the assist, that you would do that at this time as well.
So I did see some language from planning board that would make me inclined to especially refer to TAB because there were some I don't know, road interplays involved. I'd have to go back, get my computer to reboot and look at it, but I would be interested in calling it up and referring at least to TAB. I'd probably look to my neighbor to the left here on DAB.
Put her on the spot. Well, Rachel, do you want to just go ahead and make a motion to this effect here?
I make a motion to, well, yes, although I believe that I'm always asked to be more clear on why I'm referring it to TAB, so I will need to find the highlighted portion here. So I would make a motion that we call up this concept plan for review, and that we refer to TAB. I know that there were questions from planning board members, and it was identified as a key issue in looking at transportation, quality open space, and providing a desirable development. So perhaps also referral to DAB? Sure. Yeah, and I'm including in my motion a referral to DAB for giving us feedback on a desirable development.
Do we have one second?
Second.
Okay. Do we need further discussion, or could we just go to a vote on this? Just go to a vote? All right, this is a show of hands, Alicia?
Yes.
All right. Okay, all in favor of calling this up, raise your hand. That's unanimous. Okay, it's duly called up with referrals to DAB and TAB. And thank the applicant for being present, but I guess we don't have any questions at this time. I'm sure we will at the call-up hearing itself. Okay, so a couple more.
Our next call-up is item 4B, the vacation of a utility easement at 3320. Let me just double check that address because it was corrected.
I've got 3265 30th Street.
Thank you. It is 3365 30th Street, referenced under ADR 2022-00314.
I got 3265, I believe. But yeah. Any interest in calling this one up? All right, seeing none. Our next one.
4C is the vacation of 4 utility easements on the 1400 block of Broadway, ADR 2022-00294.
Any interest in calling this one up? Not seeing any. All right, so we can move to our public hearing for the evening.
Yes, sir. Our public hearing, my apology, is item 5 on tonight's agenda. 5A is the concept plan review and comment for the redevelopment of a 2.33 acre area, including the properties generally known as 2504, 2506, 2536, and 2546 Spruce Street, 2055 26th Street, and 2537 Pearl Street, with 101 residential units and 160 parking spaces and amenities for residents. The proposal includes 88 market rate and 13 affordable on-site condominiums. This is reviewed under case number LUR 2022-00033.
And for this item, I'm happy to introduce Shabnam Bista, our case manager for this application, who will give the staff presentation.
Thanks, Chris. Let me just get the presentation up.
So she's got it up here, but it's not showing up on the screens. There we go.
There we go. Good evening, council members. My name is Shabnam Bista, Senior Planner with the Planning and Development Services. And tonight I'll be presenting on the concept plan for the Papilio project, which is a mixed-use development at 2504 Spruce Street. I would like to note that this is a second iteration of the concept plan based on feedback that was provided by City Council, TAB, and Planning Board back in 2021. So a lot of the materials that you see might just be a refresher, and then I'll go into the specifically what's changed and what the current proposed project is, and the key issues as well that was presented to Planning Board for discussion, and they will be presented tonight for Council's discussion. The purpose of a concept plan is to determine the general development plan and provide specific feedback, as well as identify key issues in advance of a site review submittal. There's no formal action required tonight. The Planning Board public hearing was held on November 1st, 2022, and then this item was called up by City Council, as well as requested to be called up by the applicant on December 1st, 2022. Public notification was sent to property owners within 600 feet. Staff received 2 emails, and there were 5 members, I believe, who spoke at the public hearing at Planning Board. In terms of the location, this is located south of Spruce Street and north of Pearl. It's approximately 2.33 acres, and there are currently 7 buildings and some businesses located within the different parcels on the site. In terms of the planning framework, to provide a broader perspective, so within the BVCP framework, the Boulder Valley Comprehensive Plan, the site is part of one of the regional centers of the city, particularly the Boulder Valley Regional Center. Centers are defined as generally places with potential for infill and redevelopment, as well as higher intensity compared to other established residential neighborhoods. The BVRC is further defined as an area that should be pedestrian oriented, as well as provide human scale design. The site, as you can see, is located to the northwest corner of the BVRC, and it's subject to design guidelines as well that was adopted in 1998. Because of its unique location, it's within the BVRC, it's surrounded by a significant amount of personal service uses as well as retail offices, and has proximity to downtown and Boulder Junction. Also, as part of the Boulder Valley Regional Center, there is a connections plan that impacts this particular site. As you can see on the screen, the 2 connections that impact the site are the north-south multi-use path and the east-west secondary street. This is something that was also discussed in 2021, and it was referred to TAB for their decision and recommendation by City Council on whether the applicant can remove these or amend the plan to not include and incorporate these connections plans within the concept plan. So the plan you'll see today, the proposed project, does not incorporate these 2 connections plan. And I'll talk more about that during the key issues portion. The area is also transit rich, with the site located a half mile and a quarter mile to a lot of local bus stops, as well as within a mile of 2 regional bus facilities. The site is also highly walkable and bikeable, surrounded by on-street bike lanes with an easy access to several multi-use paths as well. In terms of the zoning context, the site's comprehensive plan land use designation is primarily mixed-use residential, and that's defined as predominantly residential uses with neighborhood scale and personal service uses. There are some fractions of the site that are mixed-use business and general business. In terms of current zoning, the site is zoned Business Community 2. And in terms of the proposed rezoning, this kind of grew from the feedback that the applicant received previously. In order to maximize housing, they are looking to propose a rezoning to mixed use 3. In terms of the surrounding context, there's a residential along Spruce Street in RH2 zone. There's retail to the east and a 4-story retail office building to the south. And then in terms of what's existing within that 2.33 acre site, there are a number of warehouses, light industrial and retail buildings with auto repair, a thrift store and furniture store. And then at the northeast corner is 2546 Spruce, which is, I mean, you can't see me pointing, but it's the Mecca building that's was determined to be eligible for local landmark designation, and I'll talk about that during the key issues as well. So in terms of project background, the Planning Board public hearing was held September 2nd, 2021. The item was then called up by City Council on September 21st of 2021, and then was presented to the Transportation Advisory Board in October. And lastly, there was a public hearing held November 30th of 2021 at City Council. And then in terms of the boards and commission feedback that the applicant received the last round of review, there were sort of 3 main key issues that were being discussed. The first one was to address the BVCP policies regarding housing. So the feedback to the applicant was to see if they can find a way to do a higher density project and more housing and more units on the site. The second one was the BVRC Transportation Connections Plan. Again, this was sent to TAB where they discussed and determined that the east-west secondary connection, which would be a street connection, would essentially serve as an alley, and there's a ditch as well to the west of the property. And they deemed it unnecessary for circulation at this time. And then in terms of the north-south pedestrian connection, TAB also noted that the site is well surrounded by street bike lanes as well as pedestrian walkways and multi-use paths. So the conversation was centered more around removing these connections plan in order to maximize the units on the site. And then lastly, the landmarking of the Mecca building. The planning board feedback was to integrate some of the Mecca building. During the last feedback or the last council hearing, the feedback was that additional housing would be a larger community benefit, and landmarking was not necessarily a priority at the time. In terms of the changes made to the concept plan, these are just some numbers of what's changed. The applicant will also be doing a presentation and providing additional information on this, but there is an increase in the number of units, and these are for sale units at this time, increase in number of affordable units, parking, height, and the number of stories as well. Just to reiterate, so the proposed project will have 101 for sale units as it stands now. There's the breakdown of the different types of bedrooms. There's 13 affordable units, 160 parking spaces, and they are asking for a height modification as well. This is just a little bit more detail on the floor plans as well as the breakdown of the units per floor. There is commercial located along Spruce Street, and then there are 3 kind of courtyards located for common open space with amenities on the 2nd floor and then a roof deck on the 4th. The applicant also provided some conceptual renderings that illustrate the building modulation along Spruce and then the corners as well. And on Spruce Street, they did incorporate some of the elements of the Mecca building into the lobby as they were proposing to demo it for this specific concept plan. And these are some of the elevations, just to kind of look at the mass of the building. It's 55 feet in height, again, and 4 stories tall. The applicant is subject to community benefit requirements, so they, excuse me, they would need to provide additional affordable units for anything that's over the allowed height and the bonus units on the 4th floor. Additionally, if the project proceeds as a for sale development, this would require at least 50% of the permanently affordable units to be included on site. Moving on to the key issues. So this is what was presented to Planning Board, and I will just kind of briefly go over each one. And before that, I also just wanted to summarize what the Planning Board discussion was, which was included in the memo. So generally, the board agreed that the rezoning would align with the city policies for additional housing and higher density. In terms of the preservation of the Mecca building, they stated that it falls under the purview of Landmarks Board. In terms of the height, mass, and scale, the board agreed that massing along Spruce Street should be modified and changed during the site review process, so the transition to RH2, which is north of Spruce Street, would be a smoother transition since there are 1 to 2 story residential buildings. So moving on to key issue 1, this just asks the questions of whether additional residential density for the site should be supported through a rezoning process. Key issue 1 and 2 are connected because in order to move forward with the rezoning to an MU3, the applicant would need to demonstrate that the proposed rezoning is necessary to come into compliance with the Boulder Valley Comprehensive Plan land use designation. And so it's important to note right now the designation for this site is majority mixed-use residential, but then there's portions of it that's general business as well as mixed-use business. So the applicant would also need to request a land use map designation change, so the entire site would be zoned to MUR, so that a rezoning to MU3 would be supported in those areas as well. There is an amendment process for the land use map designation change, which also has criteria including finding the change consistent with the policies as well as overall intent of the comprehensive plan. And then the second part of the key issue 2 is just regarding the Boulder Valley Comprehensive Plan and whether the project is preliminarily consistent with the goals and objectives. And so given the city's policy that strongly encourages new housing in an area with transit, jobs, and mixed use, particularly in the Boulder Valley Regional Center, staff believes that this has been preliminarily met. Now, in terms of the Mecca building, so based on council's prior feedback on maximizing housing, the proposed concept plan shows a demo of the Mecca building with elements of it incorporated into the development. Initially, the recommendation was to potentially landmark the building, and it was potentially eligible for landmarking as well. This past review, Planning Board stance was that this was the purview of Landmarks Board. However, staff and the applicant are seeking clear direction from City Council tonight on whether, in balancing the comprehensive plan objectives and policies, the building should or should not be landmarked. And then in terms of key issue 4, which is in regards to the height, mass, and scale of the proposed buildings, compatibility with the area. Across the street on Spruce, as you can see, there are two to 1-story homes, and the ME3 zoning allows 38 feet and 3 stories. There are some, within the design currently, there are some wall modulations and 4th floor that's slightly set back. However, additional alleviation to the massing is necessary to be more compatible with the character and provide an appropriate transition from the edge of the regional center business to more residential areas. And then lastly, key issue 5 is a preliminary analysis of the design guidelines within the Boulder Valley Regional Center. I won't go over this in detail as we are early on in the process, but this is something that we will be looking at in close detail during the site review process. That concludes my presentation. Happy to answer any questions.
Great. We've got a couple. We've got Bob and Matt. Mark?
Thanks for that presentation. This may be a question for Kurt. Have we calculated what the, I know that all the affordable housing is not on site. Have we calculated back the envelope what the contribution in cash in lieu would be?
Good evening, Kurt Fernhauer, Director of Housing and Human Services. We have, I'm going to be going off the top of my head a little bit.
Just roughly. Yeah.
If this project was to pay simply cash in lieu, I think it's like 7.7 million. If they implement it as shown, where half are on site, the remaining cash in lieu gets cut in half. I think it was 3.5 million cut in half, so that would be the amount remaining. But I can check that.
No, that's I just want directionally correct. That's helpful. Thanks.
And if I'm wrong, I'll let you know.
Thank you. Appreciate it. And the second of two questions is, and this is not for you, Kurt. This is something that I've always puzzled about. This is not just for this particular project. If a developer comes in and says, all right, this is going to be for sale units, for sale residential, how is that binding? In other words, so they build the building and they say, you know, change my mind, going to do these rentals. How is that kind of enforced? And for how long does it have to be for sale? I mean, could it be for sale for a year or two and then they didn't have very good sales and so they flip them to rentals, or how does that work?
Sure. So I'll try to answer that question. And I think the answer is that it's not enforced. It's not something we can do. However, there is a potential of including it as a condition of approval when the site review gets approved. And if the applicant at any point feels that they need to convert to a for rental or it's not financially feasible to do a for sale project, then they would need to come back for an amendment. So planning board or council would have a chance to kind of look at what that proposal would be.
So I just want to maybe follow up on that. So let's say it was built in as a condition in the site review approval that's for sale, and so the building gets built and certificates of occupancy get issued. What's our enforcement mechanism down the road after COs are issued, and then the developer either says for whatever reason I'm not going to sell these things, I'm going to lease some or all of them. What do we do? Is that just kind of tough noogies, or what? Is there some sort of enforcement there after the CO is issued?
Sure. I think when drafting that condition of approval, there would be and Teresa, correct me if I'm wrong, but there would be sort of a timing incorporated with it. So it would be either prior to certificate of occupancy or prior to issuance of building permit that some of the conditions would need to be met.
I don't know how you can meet those conditions.
Mind if I call it, please?
Yeah, please, if you know the answer.
So, well, just, Shabnam, I'm a little confused. My memory from my time on planning board was that any condition in your site review approval had to be required in order to bring them into compliance with the site review criteria. Like that was what you had to base your conditions on. And my memory was that there wasn't something in the site review criteria that would allow you to say, well, in order to be compliant, you have to have ownership units. So, because my memory is that we couldn't make a condition like that. I may have that wrong, but that's my memory from my time on planning board.
Brad, would you be able to? Sure, yeah. Kurt, thank you.
I'll answer something slightly different to that, which relates to it. So we had a similar situation at the Peloton. That project was developed with rental housing, and then it went to for sale. And cash in lieu is higher than, for a for sale project than it is for rental. So in that case, they actually, 4 years after the project was built, they had to pay additional cash in lieu back to the city. So it's a bit of reverse of that. But that's part of the IH ordinance. And I think what you're asking about falls outside of the IH ordinance, which simply states, that people have choices. As it fits, however, into conditions of approval, that's out of my league a bit. I'm not sure how to answer that one.
So any response to that? Like, do I have that wrong? Or
Yeah, I'm happy to go. My recollection is similar, Mayor Brockett, to what you described is, and I think that's what we were just kind of combining those two conversations into one, which is when it's about the use of the dwelling unit, whether it's for sale or rental, is really outside the purview of the site review process. As it relates then to affordable housing and the inclusionary housing ordinance, that's where there's a connection because of the use type of the unit is related to the fees that are charged.
so the fees might be different. And to be clear, I'm not saying I like that we can't make that requirement, but I believe that we are not allowed to actually make that as a condition of a site review approval.
So I just asked the question because I just want us to, go ahead.
I just wanted to clarify. So this was another question that did come up at planning board, and the response from Hella Penowig, who's I don't think online today, was that it could be potentially a condition of approval. So I can kind of touch base with her and provide a response.
If you could get back to us on that.
That'd be helpful. And so I guess there's two questions there. One is, can it be a condition of approval? And the second is so what? Because especially if it goes the other direction, maybe they overpaid for inclusionary housing. My guess is we're probably not going to kick money back to them if they change their minds. And so I guess I'm struggling with enforcement, because when you say, oh, well, if it's condition of approval, it's before the CO or it's before this or that. I'm talking about like the building's built, the CO's been issued, and the developer says, yeah, I know I told you it was going to be for sale, but it's really going to be for rental. And the answer may be we don't have any enforcement. And if that's the answer, that's fine. Like Aaron, I'm not happy with that answer, but that's the answer. I just want us to be really super aware of that, because we got all excited last time about, oh, these are for sale units. Maybe they are and maybe they're not. I mean, that may be the good faith intention of the developer at this moment in time, but we should all be big boys and big girls and realize these could very well be rentals. Unless you tell us there's some sort of forever enforcement mechanism and with penalties attached, which I suspect you're going to tell us there's not.
Okay, thanks, Bob. Matt?
Well, I didn't want to colloquy because there's more to say, but my line of inquiry is really kind of along these lines. We were sort of given some options at concept, or when it came to us in December, and we're like, yeah, we like the one that's got more housing. It's ownership, affordability. Yeah, rah. Good job. Thanks for listening. Then we get this plan, good, and then we hear also, oh, that's not going to be financially viable. It may not work. I get the technical pieces of what are our mechanisms, but for me, it's a larger question of how do we create the guardrails so that when we approve the concept of a plane, we're not delivered a blimp. They might both fly, but they are fundamentally different. And I want to make sure that as a community, we're investing our time on what we're committing to, but then also the community as a whole knows what we're committing to. And so I know that's the overall process we have, but I don't like where this is going, where we can have a switcheroo here where they ride the coattails of our enthusiasm of ownership, all these great things, and then pull the rug out and say, yeah, it doesn't work. I just don't like that that's a place where we can end up. So I don't know what the answer is, but it's really a follow-up there. But I feel a bit misled at this point, and I don't feel good about that.
Just note that we're in questions, right?
I know, and so I'm just sort of I don't feel good. So really, my question is like,
how do you make me feel better?
Yeah. How do we not feel the fool, I guess, is the question. And maybe it's really just the question of what are these mechanisms for accountability and holding to account. So I don't know if it's a separate question, but it's really just greater context to what maybe Bob and Aaron were inquiring at. But goodness, it doesn't feel good.
Thank you for that, Councilman Benjamin. One point of clarification is that any developer, as they're going through the process, the point where they have to, the last point of making the decision on what type of, or their approach towards affordable housing is at the issuance of building permit. So it's at the beginning of the process in the development. And so it comes, the challenge is it comes after these city council discussions often. And we've even seen this project change over time, as you just mentioned, as the developer and the architect work into what's feasible as it relates to affordable housing related to design and cost. And unfortunately, we've also seen that can change even within a 6-month period of time. We saw lumber spikes and all sorts of things that occur that impact those types of decisions. But at the point of building permit, which is a long time from now on this project, that's when their decision would be made under the IH ordinance.
I appreciate that clarity, Kurt. Thank you.
In essence, I'm colloquying with both of my colleagues, and I guess I'm asking the city attorney and the deputy city manager, are you looking at this and trying to create mechanisms to do what Councilmember Yates has requested, which is find an enforcement mechanism? If, for instance, in this case, we're being asked to give a height bonus, but if the height bonus is not accompanied by sufficient community benefit because the nature of the project keeps changing, why should the height bonus be permanent, but the use of the property, as has been described to us, be semi-permanent? I mean, we've been burned before, and I think that's kind of what my colleagues are alluding to. We don't want to be fooled again.
I hear your concern, Councilmember Yates and Mayor Pro Tem Wallach. I'll say, in a way, this conversation is premature because we're at a concept plan phase. And so to call it a switcheroo is to say, in concept, they keep changing their mind. Well, that's okay at this phase of the process. That's okay for now. I think what I hear the question is, if we get down the road and this gets through all of the approvals, and they don't honor their commitment, what is the enforcement mechanism? And I hear that question, and I'm happy to look into that and get back to council.
Thank you.
Great. Can we turn to the applicant? Seeing no further questions, we'll... Oh, sorry. I apologize, Mark. I thought that was your only question.
No. I take it Landmarks has not been afforded an opportunity to weigh in on the Metro building? I mean, I know we have a preference for housing versus landmarking, but would it not be appropriate to at least understand whether this is a building of no consequence or the greatest treasure in North America? We routinely send projects out for analysis by Design Advisory Board, by TAB. Would it not be appropriate to at least hear from Landmarks? We don't have to take their advice, but it would be nice to know whether this is something of such consequence that we ought to rethink our view of getting an extra few units. I'm not suggesting we won't change our minds, or will change our minds, but more information is better than no information. And it would seem to me that that's an appropriate step to take.
We'll get to comments on that.
Yeah. I'll just leave it to two questions. City Attorney, what is the definition of spot zoning? I've always been under the impression spot zoning is not, either not appropriate or illegal, and I look at this very particular small zoning change, and I'm wondering, does that not constitute spot zoning?
Professor Wallach, I apologize, but I am not prepared for your Socratic method today.
I'd actually be happy to.
However, I believe my esteemed colleague, Brad Mueller, who is the expert in this area, can speak to this.
I don't know how to follow that, so I might just have to fold. You know, I've always characterized spot zoning as more of a concept, and I've seen over the years throughout my career it get both demonized and praised as is the solution to all things or the worst thing in the world. And I've seen jurisdictions that try to legislate it. It's not a thing per se. It's a planning concept, and the basic concept is that zoning as a tool, and all laws are blunt tools, but zoning is a tool that's designed to mitigate off-site impacts and to minimize incompatible uses being next to each other. That's what zone districts are supposed to do. And when you get it down to a very extreme change from one intensity to another within a little area, that gets characterized as spot zoning. And that defeats the purpose of trying to separate incompatible uses. There is a lot that can be done, though, with design, and there's a big difference between a heavy industrial next to a residential versus a medium residential to a light industrial, for example. So I always caution not putting too much stock in that and recognizing that the idea of incompatibility is a fluid concept and needs to be taken in context. I don't know if that helped. It sounded kind of professorial, so.
A plus.
Okay. All right.
And Brad,
Thank you.
wouldn't you say that really what we're looking at is the comp plan, and to make sure that the zoning is compatible with the comp plan?
Right, and that's where there's this kind of chicken and egg thing. You know, if there's a sense that the compatibility is there and supports the zoning, then that kind of de facto means that the comp plan also should support that and be reflected to do that. But you also have with really your quasi-judicial, judging powers to say, no, it's the comp plan that really is guiding what the zoning should be in this case. So that gets to the site-specific kind of nature of the work that you do in your quasi-judicial decision-making.
My classes are Wednesday and Friday at 11 o'clock for all who want to attend.
Thank you.
I thought they were Thursdays at 9 p.m. But okay. All right. Now, why don't we move to the applicant presentation, if the applicant's ready to go.
Hello, everyone. This is Ali Gidfar, and I have with me Adam Rood, who is the project architect. Go ahead. Just say hi.
Hi, everyone.
Chris couldn't be here, so instead we have Adam with us. I was going to show a presentation. Maybe I will flick through the slides really quickly. I think as I'm pulling that up, I got to say that what I just heard from three of the council members is a little bit hurtful. I'm not doing a switcheroo. I've been open with you guys from the beginning about the process. I think that, just to reiterate, you asked that we look at the site for more density, and you want it for sale, and I agreed to do it. And I did say that it was going to be a very tall, hard lift. And I spent more than a year and a half, I think, trying to make this plan work, and have had it priced pretty accurately, and gone through multiple meetings with my realtors to make sure that the numbers that we're putting into the pro forma are going to work for us and for the city. And I've shared with you the results of it, and I've also said that I'm perfectly happy to have you come in and actually see all the effort that has gone into it as a learning experience for you, as it has been for us as well. So the other thing I do want to say is that this is not a switcheroo. I've been, again, very open. And if I had gone through this process all the way to the end and at the last minute said I wanted to do either for sale or rent or whatever, at that point, then it would be a switcheroo. But I haven't done that. So having said all that, I will now just quickly go through the slides because I think we all are very familiar with all the issues that are on the table. But you know, we've talked about this at various points in the meeting. And I think there was a reference made to a fourth, that we're asking for a fourth floor. We never asked for a fourth floor. The reason we have a fourth floor is because of the number of square feet that we've managed to work out that we can put on this site. And that has forced us into a fourth floor. Now I'll let Adam explain the slide.
Right, so the proposal to rezone to MU3 is in service of the goal of achieving the maximum housing on the site. And the diagram on the left shows what you do if you only rezone to MU3, but you don't add the fourth floor. You end up with a continuous, uninterrupted street wall and these enclosed courtyards, which are very undesirable. But if you do allow for the fourth floor, you're allowed to have these open-sided courtyards, which provide a lot more visual porosity into the project and does allow us to achieve the maximum square footage of housing on the site, which the FAR allows for under MU3.
Go ahead.
Yeah, so I mean, we all are aware that we're at a very conceptual level, but this slide illustrates the elevation along Spruce and some of our primary design strategies, subdividing the building into numerous identifiable portions, distinguishing the top fourth floor from the rest of the project, providing pitched roofs, and as well as that open-facing courtyard in the middle of the block. And as you can see, this is from the corner of Folsom and Spruce. We've taken steps to reduce the perceived scale of the top floor by taking a subtraction at the corners, as well as the recesses in between those separate masses. If you go to the next slide, you'll see the other corner where the Mecca building exists today, and we're proposing to demolish and reuse portions of it. A community serving cafe would stand in its place. Here is the lobby pavilion, which we're proposing to be centered in the middle of this open-ended courtyard. So these are just some of the primary strategies that we're using to kind of make this building have a positive impact on the neighborhood. This shows the top floor plan, which again demonstrates how we're utilizing these open-sided courtyards to provide as much openness and light and views into and out of the project, as well as recessing the top floor from the lower floors to minimize its visual scale. This slide illustrates some of the challenges we've been working through, and then the final slide is really about the question to councils about.
Right, and I think here, I think the question of rental or for sale, sorry, I think I messed up.
Yeah.
This first question, is it rental or for sale, is something that'd be great to talk about since it's been brought up tonight. And again, to make the project work, I think we've already been talking about this for the past year, that to have the amount of housing that you have asked for, we're going to have to rezone to MU3, get the extra height. We're not asking for it. We have to remove the Mecca building and the crossblock connections. And with that, I'm happy to listen.
Thanks, Ellie and Adam. Appreciate the information, the presentation. Do we have any questions for the applicant? Looks like I got Lauren and then Mark.
Thanks for that presentation. I have a couple of questions. What are the average unit sizes we're looking at for the various unit types right now? I know that things are a little bit in flux, but.
Right, so for the for sale unit, what I can tell you is that for the for sale project, we averaged 1,400 square feet. And when we discovered that the project was absolutely not going to work as a for sale project, couldn't get any investors on board that would take on that kind of risk, and I communicated that with you guys. I hired an apartment consultant in Denver, and right before Christmas, they gave me the mix that would work, and I shared that with you as well. And that mix is at 850 square feet per unit, roughly. Does that help?
Yeah, thank you. And just to clarify, I mean, I know you've discussed this a little bit already, but the difficulty in making this pencil out financially as a for sale, is that driven by with the increased height needing to do 50% of the affordable on site, or would you still have issues making this pencil even if that requirement was not in place?
That's exactly right. And even if that wasn't in place, and I'm happy to, let me share with you. This table, I think, I don't know if you can see it or not. This is what I emailed you a couple of nights ago. But what it, yeah, there we go. What it illustrates, it illustrated to us, and I'm trying to share that with you, is that even if we do the MU3 on the far left with the zero affordable on site, and just paying cash in lieu, which you can see, and I've had to kind of mask the actual numbers. And again, I'm perfectly happy to share all this in my office with you live, but you can see that the profit margin at the bottom is what really drives a lot of projects, and more importantly, the IRR. And those numbers are low enough that I can't attract investors to the project. And if you look at the far right-hand column, that's with a 36% IH that would be required on site. That's 14 affordable on site. And whereas the cash in lieu is only $8 per square foot in this scaled version of this chart, that's in reality $1.65 million. The loss in revenue of those 14 affordable units on site is $12 million, which is why that the IRR number tanks, as does the profit margin.
Thank you for that clarity on that.
Sure.
In thinking about moving towards rentals, you know, you're saying that 850 square feet makes more sense. Would you be intending to keep the same square footage for the building? Like,
yes, I think what we're
so
saying,
the intention would be to do more units?
Yeah, I think what we're saying is that we would take the same building volume and rework those extra units into it, so that basically nothing changes about the building visually for the most part. I think you're going to end up with more balconies and exterior elements like that, different window patterns and things like that. But we try and work within the same building envelope that we've been presenting so far.
And do you know approximately how many units you would anticipate that being?
Sure, it's 165 units.
And then my last question is about the Mecca building. You have that lobby space that looks sort of like the repurposing of the Mecca building. Is your intention right now to keep the glulam beams from the existing building, or are we making new ones that look similar? What's the idea there?
Well, if we can reuse them, we would. We just don't know what shape they're in until we actually get to that point. And if we can't, then we would try and sort of take that as a design homage, if you like, to the existing building.
And what point do you anticipate knowing for sure whether you'll be able to keep them or not? Is that something that will be happening after the permit is issued?
I think we should be able to explore that before permit is issued. I think we can take a look at those beams and see what shape they're in pretty early on, I would think, because an engineer would have to be comfortable with reusing them.
Thank you. That's it for my questions.
Okay, Mark?
First, I want to apologize. I want to apologize. The comments that were made were not directed at you.
Oh, good, thank you.
No, it's that we have had some unfortunate experiences with developers who were less reliable in their representations, and it's a little bit of a sore spot, and we're trying to.
Right, no, I understand.
Okay.
And I apologize. I just got really upset about that, just because I can't tell you one thing and then do something else. So it's not me. I can't do that, and I just want to make that very clear.
My question is, looking at your pro formas, if the 101 units with 14 affordable on-site is producing a 3% profit margin,
right,
which is obviously not going to be acceptable, does that mean you don't want to do that?
No, I can't do any of those scenarios. That's why I'm sharing that with you, just to say how difficult it is to make a for sale project work. And as you remember, the reasons for that are far higher insurance during construction, higher construction standards and costs. And yeah, those are the two main things. And of course, the IH requirement to have all those units on site kind of tip the scale completely over.
And so
it's not all on IH. Let me just make it very clear. It's not all IH, but the difference between for sale and rental for IH is quite significant. Let me just say that if we were to do, if we had the option of not having the units on site, then IH numbers are roughly the same between for rent and for sale, roughly. And if we're not penalized for that fourth floor.
And so in effect, are you now proposing a rental with cash in lieu payments? Or I'm not quite sure what you're...
Yes, that's the idea. So that I think the only way we have forward is to look at this project with greater density and for rent. We're 100% sure we can't do the for sale, unfortunately.
Okay, thank you.
Nicole?
Thank you, and thank you for the presentation. One of the things that I was wondering about looking at the new design, and thank you so much for listening to so many of our previous comments and working to incorporate them. It's around the parking, and a lot of the space is kind of set aside for cars.
Yeah.
I think, we as a city, we're very interested in housing people, less so cars, especially in such a transit-rich area like this one. Yeah. And so, looking at your financial numbers, if there were some reductions in the parking, for example, would that lessen your costs enough to have some on-site affordable or more units or anything like that?
Well, here's the, I guess the fortunate or unfortunate thing about MU3 is that the reason we get the bonus square footage is that we have more parking. So we've created a building whose first floor is entirely cars because that's the area that we can take to increase FAR. It's kind of a perverse thing that we have in our codes, but that's the rules that we're playing by. And if we do move forward with the rental model, we'd actually be asking for a variance on parking because MU3 requires 1 spot per unit. We have 165 units and 161 parking spaces. 7 of those spaces need to be reserved for commercial space. So in other words, we're going to be short somewhere around 11 or 12 spaces, if you like.
Thank you. I appreciate that. That was my question.
Okay.
Thanks, Ali. And I share Mark's statement. You guys have been forthright, and you guys have done a lot of transparency. I think it's the situation that we find ourselves a bit frustrated with. So know that, and know that we hopefully can continue to work with you to try to find a way to make this work. So my questions really center on, really trying to figure out where where a nexus is with rental and ownership. In particular, one is a mix of those two even viable? So that's one question. And I see you shaking your head. So the answer, so you say no.
No,
and then
you have to go one way or the other, unfortunately.
And is that a market decision, or is that a prohibition that we have in our city that limits a mix? So
no, it's more about getting financing. I think I'm pretty sure that it's going to be very difficult to get financing for a mix like that. If it's one building, if it was two buildings, it'd be a different story.
Okay. And really, so where the follow-up comes into is in terms of trying to achieve ownership, and this question is to you and also perhaps a holistic one for our community as a whole, are there any city codes or ordinances that as you're looking through this that you look at and you go, yeah, if those were changed, we could make this pencil out for ownership? And so that's a question, because again, I think there's some that value having more ownership in this community, and I want to know, really, are we in our own way, or are we talking about market forces that are prohibiting this goal from being achieved?
I would say that market forces are definitely the larger piece of the fault. But if you look at the IH code, the way it's just set up, it doesn't make sense, because we really want to encourage for sale condos, and there's this huge increase in how that works against the developer, and so all the forces are pushing us towards rental and not for sale. And yes, part of that is the IH component that I know that you all are aware of it, and Kurt is aware of it, as is Michelle, and it's hopefully something that can be fixed quickly so that we can turn this around. But the issue is that in our state, those defects laws are really onerous and really forces us to pay through the nose for insurance. I think our insurance costs are at least 3 times for sale versus a rental. And construction costs are enormously higher. I think to build stick framed over a concrete podium for rent project versus an all concrete and steel building, obviously there's a huge difference in that. And we've talked about that in the past year or so.
I appreciate your answers to that, so thank you.
Mm-hmm.
Okay, seeing no other questions, we can go to the public hearing. We've got 2 people signed up to speak. Both of them are virtual. Each of them will get 3 minutes to speak, and they are Lynn Siegel and Rebecca Bach. So we will start with Lynn.
Well, what we don't want here, and if I get unclear at all, please stop me immediately,
sure.
is another Frew house. Okay, that's what no one wants to say Don Altman, no one wants to say Michael Bosma, but those are the guys at 311 that pulled off the thing that you're having to deal with, Ollie, because you get the bad rap from that. But, developers in town should get together and not violate people or they're going to have trouble later on. My feeling is you should go back to version 1. Just go back to version 1, It's not you're not going to make this. You can't create, for sale housing on new build. If you want to get for sale housing, take some old crappy condos in Boulder and sell those to people. But this is just like a shot, like dreaming. It's not going to happen. So, don't waste more concept plans and stuff. Just go back to the first. And then my thought also really is, yes, this is Boulder Valley Regional Center, but you know what? For me, Hoshi Motors was everything, and now it's way out. And I ride my bike mostly. I drag my car with my bike if I could to take it out there, but that's kind of hard to do, when it's way out now east of town. So I want my services close into town. Boulder Electric, gone. You know, where do somebody stole my catalytic converter, so I'm not just hauling my steam cleaner, you know, to Billy's Boulder Electric. I got to go to Denver somewhere. No, I'm not going to do it. You know, and you know, and then we have meth in the bathrooms at the library. Okay, this is what you're saying, Ollie. You know, you can't make this happen. You've got to make a certain profit. You know, you're dealing in Aspen stuff. You know, and you're in Boulder, and we've got, you know, this really bad homeless problem. That now, what are they going to do? Tear out all the drywall too in the library? That wasn't even discussed tonight. You know, these are big. When you got a meth house, you've got to strip it down to the frame, basically, or maybe even have to demo the whole frame too. And that's what happens when there's this greater wealth dispersion. And then when you get the 850 square feet, of course, you got a parking space for each one. Then you've got too many, you know, then you're short.
Lynn,
right?
your time is up, but thank you for your testimony. And now we have Rebecca Bach.
Thank you. Can you hear me?
Yes.
My name is Rebecca Bach, and I am the business owner at 2546 Spruce Street. I rent the entire building, and it houses one of Boulder's last locally created, female-owned, and operated fitness concepts called Mecca Fitness. Mecca is not a national chain. It was founded in Boulder specifically to address the fitness needs of this unique community. We have operated in Boulder for over 10 years, and I employ over 20 people. I dare say we are one of the most loved local fitness brands left in this town that survived the pandemic. My building was surveyed in an architectural inventory and recommended for designation as an architectural landmark. The city planning staff recommended finding a way to preserve the building. Clients always comment to me on how beautiful and unique the Mecca building is. You should drive by and check it out, and I welcome you to join in one of our classes. Preserving this significant and historic building would decrease the number of condo units by approximately 4 to 6 housing units per the developer. This is within a complex of nearly 100 market rate units. My business employs 20 people and has served the community for over 10 years. I know I'm biased here, but I don't think that is a good trade, and I'm sure these units could be redistributed elsewhere. Frankly, this project will make my business homeless. Commercial real estate that is accessible to the population's daily needs, has easy access and good parking, you have to have good parking, is nearly impossible to find. I started looking over a year ago and so far have not found any suitable space. Without a good central location, access to lots of parking, we can't survive. Part of the reason space is getting so scarce is because of projects like these. Commercial space is being torn down for $1 million condos. It seems to be happening everywhere in Boulder. We can pay market rent, but when space is available, it often goes to national chains. I remember when this quirky town supported small local businesses. That is the Boulder I fell in love with. I'm afraid we are headed quickly in the direction of a generic town that could be anywhere in the US that is filled with nothing but a sea of chains. To sum it up, Boulder is a special place. I've lived here since the early 90s. It's beautiful and vibrant. Continuing to tear down local businesses to build pricey condos is not a direction to keep the flavor of Boulder alive. It is not making Boulder more diverse. This is the wrong move. Thank you for your time and consideration.
Thank you, Rebecca. Okay, so that brings the public hearing to a close. So we'll bring it back to council for discussion. So what I'd ask is if we could get the key issues put up, and so maybe we can tackle those one by one, but hopefully efficiently, as the hour is now almost 9:30. And in fact, actually, we need to do a time check on that basis. So it is 9:30. We have one significant item left, so ideally we would give our feedback on this item pretty quickly. It's important that we give good feedback, but also hopefully we can do it pretty quickly in order to finish out our agenda tonight. We'll check in again after this item is over. Okay, so we got 5 key issues, and let's just tackle them one by one here in the order that they've got them. So the first one is, should additional residential density for the site be supported through the rezoning process? They're proposing the MU3 zone, which allows for additional density based in part on our feedback from last time. Quick thoughts on this one? Do we just want to maybe do a straw poll if people don't have a, generally do people feel that they're comfortable with this? I'm getting head nods. Okay. So it looks like, yep. Mark, did you want to say something?
Yeah, and I guess this is a question for the developer. The staff memo and the planning board had some thoughts about reallocating the mass of the building in terms of Spruce Street versus other streets. Are you planning to do that or not?
Actually, I think we're going to get to that under number 4, which is about the height, mass, and scale.
Then I'm going to wait.
Okay. Okay, so it looks like we're generally comfortable on number 1. Number 2, do we feel like the concept plan is broadly consistent with the goals, objectives, and recommendations of the comprehensive plan? I'm getting thumbs up. Okay, so that's pretty clear. And then staff is really looking forward to some concrete feedback on the preservation of the Mecca building as part of this project. So we could use a couple comments here. Rachel? And Matt?
I'm sorry, it's kind of a question flowing from the last speaker's comments at the public hearing. I think I recall when we were redeveloping the Hill Hotel, we put a clause in that required some help with relocating businesses that were being displaced. Have we looked at that for this? Can we do that? Because I don't know that I'm committed to the building, although I am actually a big fan of that style of architecture. So, I could go either way, really. But I am very sensitive to what the business owner was saying and would like to not displace her business if we can find a way there. Or if she's displaced, to help her, be able to afford a new place, I guess, and moving expenses.
Do we have options as part of this process to request or require relocation assistance?
I think since this is a concept plan, it's a fair discussion, but it's something we would get into with the applicant during the site review process.
So I guess we give feedback at this point rather than requirements.
So my feedback would be, let's try and figure out a way to make that tenant whole through relocation assistance or whatever else might be needed.
Thanks. Matt?
I get, with feedback, I'm less beholden to wanting to keep the building as it is in its current location. I think that prohibits, what's trying to be built there. But I would really love to see elements of it, either directly materials utilized, that cool roof, the glue lamps that was mentioned, or at least those interesting design elements sort of folded into the design, which I think has already sort of been done in few spaces. But I'd love to not see it evaporate into the ether. So there's still some elements left for us to enjoy in one form or another going forward.
I'll call myself and then Mark. Yeah, so I agree. I don't feel like the building itself needs to stay there. I like how your initial plans show design elements, both actual physical pieces of the building potentially, or at least the design elements from it. I think please continue in that direction. I think that's really positive. But I was going to bring up what Rachel said as well about relocation assistance. I feel for Ms. Bach and the difficulties there. So I feel like assisting that business with relocation would be the right thing to do as part of the process. Mark and then Bob.
For the reasons stated earlier, I do think having landmarks look at it would be useful. But having said that, I am also very reluctant to displace a business with 20 employees that is local and that is important to our community. And I think it is just too easy to run over those businesses and simply say, vaya con Dios, too bad for you. It's part of what makes us vibrant and different, and I'm very, I would like to see all efforts made either to accommodate this business or to relocate it with the assistance of the applicant and or the city.
Very good. Bob?
Yeah, I'm going to concur with my colleagues. While it's a beautiful building, and I like it too, Rachel, I don't want to stand in the way of 4 to 6 or 7 housing units, and so I think the developer and the architects have done a good job of trying to incorporate some of those elements in. If they can do a little bit more, that'd be great. And I also support relocation assistance for the tenant in the Mecca building. I want to disclose that Rebecca and I used to work together at another company, so I'm not saying that because we used to be work colleagues. I'm saying it because it's the right thing to do.
Great. So I'm hearing a consensus here, but Lauren?
And then, in my opinion, for the Mecca building, I really strongly support repurposing parts of it, but not recreating. If those parts don't work out, it doesn't seem to make sense to me that we like Disney-ify it and keep it in perpetuity.
I think you used the word homage, which I kind of liked. All right. Yes.
Just one other disclosure. I have previously spoken to Rebecca on other matters, and just wanted everyone to know that.
Thanks. Okay, is the height, mass, and scale of the proposed buildings compatible with the character of the area? So, Mark, you might start, because you had a thought here.
Yeah, both staff and planning board recommended a shifting of the massing to make it a little more humane on Spruce Street, and I think they were looking at Pearl Street as a better location for some of that. Can you accommodate any of those concerns?
Question for the applicant.
Yes.
I think what Shears Atkins Rockmore has come up with in terms of a plan on massing, they've tried to be very careful about the mass on Spruce Street. And the reason for the way it's been set up is that the courtyards that face south will have more units that face south. And so in order to flip the building, what we're saying is that the units would more of the units, 2/3 of the units would have north light versus south light. So that's the downside. But the concept of the building itself, I think it's a brilliant one. I think they've done a great job with that.
Okay, well, then I would urge you to think about that possibility, since it was endorsed both by planning board and staff. I think that's something you might want to give serious consideration to.
Okay.
I'll call on myself here. I think that you've done some good work on that north side to break up the mass. Like you have the courtyard in the middle. It's the lobby entrance there, which looks good. There's some step backs on the fourth story. And I understand why more people would want to have south-facing units, right? That's just going to have a higher quality of life. So I probably wouldn't suggest that flipping of the two courtyards to the north. But if there are any additional moves that you can make in this direction to relieve the massing on the north side, I think that would be positive. So I think I would continue to work on that as you move forward to site review.
I think it's possible to take those areas that are the negatives on Spruce Street, meaning the ones that are intended to feel as though they're more in shadow or setback, to actually increase that setback dimension so that there is more relief on Spruce Street.
Yeah, that makes sense.
Would you agree?
Yeah.
Very good. Further thoughts on this, Lauren?
Yeah, I agree sort of with what you suggested and what Aaron just brought up, that as this continues to be developed, I think that just continue to look at ways to break down the mass a little bit more on that Spruce Street side as you continue to refine it. And I think that would be sufficient for me.
Okay. Tarek?
I agree with you too. Yeah. I think the lighting for the people that are going to live there is actually important, and to ask them to live in the north darkness in a small unit, right, 850 square feet now, is asking a lot. And so I'm going to agree with you, Aaron and Lauren.
Okay. So are people comfortable with this feedback that we've given so far? We good? Okay. So I think that's the answer on 4. And then number 5, does the concept plan preliminarily meet the BVRC design guidelines and connections plan? It's probably a little early for the design guidelines, but I think, are we comfortable with the changes to the connections plan that have been proposed? Tab liked them. Are we okay with these? Okay. Then I got thumbs up on that. So that covers our key issues. Did anybody have any extra final thoughts that weren't covered by this, or are we good? Yeah. Nicole?
I just had a question getting back to the parking, because Ellie, you seemed a little, I don't know if you were just excited to see a new face or you seemed a little interested by this idea. But, one of the things I'm thinking about is the housing stock we're going to need in 25 years when our population is significantly older, right? We're going to be looking for kind of more smaller units and things like that. I'm just curious from my colleagues, really, would anybody be interested or open to a special ordinance if Ali could reduce the parking and get us more housing units. And I don't know if that's even possible, but I'm curious from colleagues if that's something that would be of interest. Could we potentially reduce parking, given that we're heading toward a future with less cars?
I'm pretty sure I read in Ali's notes that for people to buy units, they really do want a place to put their car, even if they don't use it. So I don't think it's something I would agree to, just because there is winter here and people do have a car, even if it's just one. And so I think that's asking a lot for older people to not have a car in the winter.
Well, I'll just, yeah, go ahead, Ali.
I was just going to say that if we do go down the rental at 165 units and the number, there'd be 154 spaces for those 165 units is the way it would work out. So we're already we don't have enough parking spaces for the unit count that has been recommended.
Good. Well, I'll just call on myself to Nicole's question. I mean, I feel like having almost the entire first floor be parking is an inefficient use of the space. So I'd be open to looking at potentially a bigger parking reduction. So it's worth exploring as the project moves forward. I would just say, yeah, Lauren.
But the issue, right, is that you need the square footage, the amount of square footage in the parking to get the amount of square footage of residential, similar to what we had at Macy's, right? So it would require a special ordinance for a reduction in parking square footage, as opposed to like when they're doing the additional units, that's just a parking reduction on the unit count. And so I think it seems, and I could be wrong, but I would imagine we have broad support for the parking reduction based on unit count. But I think the question is there any support for a special ordinance to reduce the square footage of parking and keep the residential area the same?
Thanks for articulating that, Lauren. Yes, and which I understand, and I guess I might say to that specific point, like, it's probably not worth it to remove 5 parking spots. But if you felt like there were a significantly more valuable use of the first floor, for part of the first floor, and you feel like you could implement a strong transportation demand management program to accommodate some fewer cars, it might be worth considering, to your specific point.
Yeah, and I agree. I would be open to considering it, but I'm not sure what it gets us at this point.
Yeah. So I think some mixed feedback there. Any other final thoughts? Ginny?
Thank you. I just wanted to say, as I was hearing all my colleagues make their comments, I just wanted to thank Ali for the level of engagement all throughout this process. I have seen he's reached out, he sent email to us, he invited us to in meetings to also look at the plan with him. So I really appreciate the details and also engaging all of us into this process. So at least I've been very engaged, so I really appreciate it. Thank you.
Thank you.
Okay. Lauren?
And I just wanted to check in, is there any other questions that you would like, that would be helpful for us to answer as you move forward?
I think that our next step is to go for the rezone so that we're comfortable as we continue to develop the plans and spend more money on Adam here. we're headed in the right direction. So if I think I've heard from your comments there that everybody's in support of the MU3 upzoning. Is that this case?
Yep, that was key issue number 1. We had thumbs up.
Great. Okay. Well, I appreciate that.
Great. Staff, do you need anything else from us? We feel like we've gone through the issues.
Yeah, thank you.
Great. And then Ali, sounds like you've gotten the feedback that you need, so.
I have, and I appreciate it. I'm sorry I got upset at the comments that were made. They were general, but we spent so much time and put so much heart and effort into this that was a little bit disheartening to hear. I thought it was against us, but I understand.
Okay, no worries at all. So I think that wraps us up on this item for now, and thanks everybody for your work on this, and we'll look forward to the next iterations.
Thank you.
Thank you very much.
Thank you. All right, so another time check. It's 9:40. We have one thing scheduled for approximately 60 minutes. Are we game for it? Yep, good. No, it's not. Okay, so let's do it. Elisha?
All right, sir. Thank you. Our next item on tonight's agenda is item number 6, matters from the city manager. 6A is the shared micromobility update related to e-scooter pilot program evaluation.
Great. So, Chris, I'll turn to you to hand off to the appropriate staff.
I am happy to. For our last item of the evening, we have our interim director of transportation, Natalie Stifler, as well as transportation planner, DK, who is here for a little while longer for us, but he's pulling up the presentation, and then we'll dive right in here.
So, DK, is this going to be your swan song at the city council?
Yeah.
Going out on the scooter.
Okay, well, good. Okay, well, we look forward to one last DK presentation.
It's been a pleasure. I tell you, working here at the city of Boulder the last 8 years, we've done a lot of fun things, and I won't be far. And so I'll maintain contact and. That's fun. Okay, there we go. So anyway, I've really enjoyed my time here. Thank you for working with me over the years.
Absolutely.
Okay, let me see here. Bear with me, I've got a little bit of a cold that I'm coming over, so you're going to get the Barry White voice tonight. Hope that's okay. Okay, too much fun. All right. Sorry. All right, well, good evening, Council. I am DK, Senior Transportation Planner, and it's great to be back with you all this evening. We have a lot of information to share with you regarding the key findings from the shared e-scooter evaluation report, as well as some preliminary next steps to formalize the program in 2023. We look forward to addressing any questions following this presentation. Before we jump in to the details of the evaluation report, it's important to revisit the overall goal of the shared micromobility program, which consists of both e-bikes and e-scooters. Our goal is to provide safe, equitable, and sustainable forms of transportation that improve quality of life, provide connections to transit and key destinations, and replace motor vehicle trips to reduce greenhouse gas emissions. Before we initiated the shared e-scooter pilot program, staff identified several criteria by which we would measure the efficacy of the program. All these criteria were evaluated during the pilot program, but with a special emphasis on safety and sustainability, as these criteria were and still are of very high importance. And here's where we are in terms of the overall shared e-scooter evaluation process. In 2020, City Council directed staff to include e-scooters in the shared micromobility program, but in a limited service area east of 28th Street, with the intention to test e-scooters and determine if they are in fact a good fit for Boulder. Since then, we've selected a vendor, Lime, who's with us tonight, through a request for proposal process, and on August 17th, 2021, we launched the pilot program. Staff has collected data and community input over a 1-year period, and we've shared the key findings with several community stakeholders over the past few months. Following City Council's input tonight, we'll finalize the proposed next steps for the program and begin to incorporate any changes this year. Okay, now let's turn our attention to the key findings from the shared e-scooter evaluation report. Since the start, staff has been observing the operational aspects of the program and it's been a mix of both good and bad results. On one hand, the shared e-scooters have been proven to be a new, convenient form of transportation for people to get to work, school, and to shop and run errands. On the other hand, e-scooters have had a negative impact on people also using sidewalks and multi-use paths, and particularly those people with disabilities. The next few slides will further explore what we've been hearing, who's using e-scooters today, and some general utilization statistics. This past September, the City of Boulder administered a questionnaire and over 1,000 people responded. We've summed up the major themes that we've heard from this questionnaire a Lime customer questionnaire, and numerous Inquire Boulder reports, as well as direct feedback to staff over the year. In addition to the issue of impeding sidewalks and multi-use paths, people have also witnessed e-scooters abandoned in creeks and ditches, observed unsafe riding behaviors, and have expressed concerns that the unorganized parking of e-scooters have added clutter to many neighborhoods. But there's also an appreciation for shared e-scooters, as they provide a new alternative to driving and are considered a more convenient form of transportation, and quite frankly, they're fun. Following this first round of community engagement, staff packaged what we heard over the course of the pilot program and shared it with several boards, commissions, and community stakeholder organizations listed here on this slide. Generally speaking, stakeholders expressed support to expand the shared e-scooter system citywide, and many envisioned e-scooters as part of a comprehensive multimodal transportation system. Some of their concerns remain consistent with the feedback we've initially heard in terms of improperly parked e-scooters, blocking sidewalks, potential conflicts with pedestrians, and the desire to keep improving safety. So today, Lime has over 40,000 unique customers in the Boulder market alone. Their customers are the average age of 31 years old, and most of them live in households earning less than the median income level. This could be attributed to a high number of college students using the program. And there also seems to be an equal split of people enjoying the recreational value of e-scooters and those people using e-scooters for utilitarian purposes. Okay, now let's look at some of the general stats. At the start of the program, 200 e-scooters were deployed through a demand-based cap formula. Lime now has 300 e-scooters operating in East Boulder. A demand-based cap helps to regulate the overall number of scooters in a market, ensuring there is sufficient supply for people wishing to use an e-scooter for their journey. Over the course of the pilot program, 115,000 trips were generated, equaling nearly 118,000 miles traveled. And as you can see, e-scooter trips are generally short, about 1 mile. Excuse me. We estimate that 25% of e-scooter trips displace motor vehicle trips. This estimation is based on a statistically valid survey administered by Lime in 2019. The resulting greenhouse gas savings is approximately 26,000 pounds, which is equivalent to about 1,300 gallons of gasoline consumed. As for safety, through the review of CU Boulder and City of Boulder police records, our data shows that there were 4 crashes involving moderate to severe injuries. In all 4 cases, the injured person was transported to the hospital via ambulance. And because safety is such an important criterion, let's take a deeper dive. Our report examines city and university crash records only. That said, we've also been coordinating with Boulder Community Health's trauma unit, and unfortunately, they did not have a system in place to track shared e-scooter crashes in 2022. However, this is something they are planning to track in 2023 in conjunction with the state of Colorado, so that will be a good source of data to compare our crash records to. Frankly, based on the early national shared e-scooter crash data, we honestly thought we'd see more frequent and more severe shared e-scooter crashes, but we didn't. We think this is due to several contributing factors. 1, the durability of the e-scooters has greatly improved since 2018. Number 2, more people have become familiar with e-scooters based on experiences elsewhere. The City of Boulder has a robust and maintained network of walk and bike infrastructure. And finally, most drivers do have a greater awareness of vulnerable road users due to Boulder's already high number of people walking, biking, and scooting. That said, operational challenges still remain for people walking and for people with disabilities using sidewalks and multi-use paths. And although no crashes have been recorded between people using shared e-scooters and pedestrians during the pilot program, there's still a perceived risk, which could lead to people choosing not to use these facilities due to fear of getting hurt. Okay, now let's take a closer look at mode shift. As I mentioned earlier, we used a 25% figure to estimate mode shift for motor vehicle vehicles to an e-scooter. But it's clear from the responses in the questionnaire that shared e-scooters may be displacing more motor vehicle trips. In fact, nearly half of the e-scooter trips appear to have done so. That said, active transportation trips are also impacted. Nearly 30% of respondents said they would have walked if an e-scooter was not available. It's evident that e-scooters provide a faster means to get to a destination over walking, which hints at the convenience and efficiency factors that e-scooters do offer. We also ask people where they normally ride an e-scooter. Bike lanes and multi-use paths are very popular. And some people indicated sidewalks. Staff wanted to know why people are riding e-scooters on sidewalks, since it's illegal unless there is no adjacent bike facility in the street, then they may do so. But the number one reason why people don't want to ride in the street in a bike lane is because they are fearful of vehicular traffic, vehicular speeds, and also traffic volume. They're looking for more protected facilities, like protected bike lanes, and right now some sidewalks offer that protection. Okay, now let's shift our attention to overall utilization. We also examined utilization in other identified zones within the city, like employment centers, CU Boulder's east campuses. However, for the sake of time tonight, I will not be covering those areas in tonight's presentation, but if any questions come up regarding those areas, we are prepared to speak to those. Okay, this is an interesting map. The heat maps represent all routes traveled within East Boulder service area. And as you can see, e-scooters have penetrated all parts of East Boulder, and they have been ridden on nearly every street and multi-use path. The dark purple corridor running north-south is 30th Street. And here's a look at trip starts. The dark purple polygons indicate high activity levels. And as you can see, all focus areas are in these zones. If I showed you a trip ends map, it would look very much similar to this map, in that most trips are under 1 mile. 29th Street Mall is a major destination, indicating shared e-scooters may induce some economic activity, connecting people to goods and services. There's also a high number of trips being taken between CU Boulder campuses and to the 28th Street East Boulder boundary to reach the main campus. The inclusion of racial equity considerations has been rooted in the development of the overall shared micromobility program and was integrated into the e-scooter pilot program objectives and scope of work as part of the request for proposal process to select an e-scooter vendor in early 2021. A stipulation of the city services agreement with Lime requires Lime to provide shared e-scooter accessibility to community members of traditionally underserved underserved neighborhoods. There are 5 racial equity areas identified in the East Boulder service area, and being Orchard Grove, San Juan del Centro, the Vista and Parkside villages, and San Lazaro. In total, there were 9,370 trip starts stemming from the racial equity zone area. Lime's affordability program, called Lime Access, has experienced somewhat low participation in the first year of operation. And this may be due to participants' unwillingness to share personal and financial data with a private entity. As staff approaches program formalization in 2023, staff will continue to ensure that racial equity remains a central consideration of ongoing program improvements. Staff will focus on increasing participation in Lime's affordability program and reaching out to service providers and community-based organizations to amplify the availability of this assistance and refine its offerings based on feedback from communities of need. Okay, so before we transition to the last part of the presentation and share staff's proposed next steps, let's take a quick look at how Lime and B-Cycle are working together. This is fascinating. Combined, B-Cycle and Lime have 600 shared vehicles operating in Boulder, 300 e-bikes and 300 e-scooters. Together, they've generated 513,000 shared micromobility trips during the pilot program timeframe, equating to approximately 817,700 vehicle miles traveled. This result surpasses the city's shared micromobility program objective to generate 440,000 trips in 2023, and we are on track to achieve the remaining objectives by next year. It's evident that shared e-scooters operating alongside shared e-bikes work together to complete the city's micromobility program. And it's making progress toward achieving the Transportation Master Plan goal of shifting trips away from motor vehicles and reducing greenhouse gas emissions. Okay, I promise. This is the final section of tonight's presentation. The key findings from the evaluation report and community input to date have informed a preliminary set of proposed next steps to guide the transition from the pilot phase to a formal program. Okay, let's begin. Here are the initial program areas we think comprise the foundation of our next phase for the shared e-scooter program. We're exploring service area expansion, mandatory designated parking zones, improved safety efforts, transportation demand management tactics to increase ridership, specific racial equity action items to optimize the program for disadvantaged community members, and finally, ways in which we can use collected fees to support the program moving forward. Expanding the program citywide is a proposed next step, but to do so in a manner that exercises a strategic and coordinated approach with stakeholders in Boulder's most sensitive areas, such as Pearl Street Mall and University Hill. Staff will also continue coordinating with CU Boulder as they deem the appropriate steps necessary to continue expansion on CU's main campus. These identified dismount zones for downtown University Hill were recently adopted by City Council during an update to the Boulder Revised Code in 2019. This may provide an initial roadmap to create a restricted riding area for e-scooters. And to address many of the concerns associated with improperly parked e-scooters in sensitive zones like Pearl Street Mall, staff is proposing the designation of mandatory designated parking zones consisting of both on and off-street signed and marked facilities. Coordination with stakeholders on these locations will be imperative to the success of the strategy, and this next slide provides an example of what these designated parking areas may look like. So here we have two examples, one on CU Boulder's main campus, and then another one, Park East Square, which is in the city right away, near East Boulder campus. Both are using paint, and one has also used post to demarcate the designated parking area. The designated parking areas are also created through geofencing technology, and so that the ride cannot be completed until the scooter enters that zone. Then the ride may be ended. The user may end the ride. Okay, safety. Safety obviously is paramount, and we believe the next steps will continue to improve safety and existing operational challenges. I'd like to highlight just a few. First, most importantly, we're going to eliminate impacts to people with disabilities on sidewalks and multi-use paths. We want to create a culture of safety and courtesy on our multi-use path system through signing, marking, and safety education efforts. And we want to ramp up safety education messaging through special events and social media campaigns. From a TDM perspective, there's great potential to integrate memberships for people living and working within 3 of the city's general improvement districts, as well as student membership program with CU Boulder and possibly Naropa. And in terms of racial equity, there's more work and coordination to be done to optimize the program for people living in traditionally underserved neighborhoods, such as San Lazaro, San Mondo Centro, and Orchard Park. Through continued coordination with the city's Connectors and Residents program, we aim to remove barriers to access Lime's affordability program and increase overall utilization stemming from all racial equity zones in Boulder. The city has been collecting license and per ride fees, and to date has amassed over $20,000 from shared e-scooter operations. Combined with revenue from B-Cycles license and per trip fees, the city will determine the appropriate expenditures to support and advance the overall shared micromobility program. Okay, now let's circle back to where we are in the process, and following tonight's discussion, we'll fold council's feedback into our overall next steps to refine the program. These steps will be implemented over 2023 and will continue to coordinate with affected stakeholders and monitor and evaluate the program over time to ensure program optimization, particularly in the way of safety and sustainability. So in closing, here's a question for council to help stimulate tonight's discussion, and thank you very much for your time.
Thanks so much for that, DK. And I just have to ask, so are the Lime folks in the audience, have you all been here since 6 o'clock?
Yes, sir.
Yes.
I hope you've enjoyed our meeting. And
We both live right around here, so.
okay, good. I hope you're getting paid overtime. So anyway, thanks for being here.
Thank you, sir.
Questions for staff before we give feedback? Rachel? Matt? Lauren?
I do have a couple questions. I'm gonna have to scroll through here to find them. So on the serious injuries column, it looked like there were 4 serious injuries, 2 were severe head injuries. And then, I read the crashes often happen because of human behavior, and we're trying to make it more safe. But did we do a root cause analysis? It looked like some of it was speed related, and I just, are we doing everything we can, like having investigated those specific crashes in our town to figure out if we needed to make any changes?
Yes, with every crash that occurs, particularly when there's severe crashes, we do an analysis to figure out how and why they happen. We work closely with PD on those.
But did anything cause any of those accidents that's creating a change in what we want to do going forward, I guess?
Unfortunately, one of the crashes involved inebriation, so it was behavioral. And then the other was loss of control on the sidewalk, and the person, when they fell, hit their head.
Okay. Well, the inebriation one maybe gets to my next question, which is I saw that we want to expand hours maybe past 11 for service industry workers, I think. Is that just for, because I think we were pretty intentional about, like, we're going to cut it off at hours when people might be most likely drinking. Right. How will we know, like, how is it going to be just service workers who are going after 11?
We do plan to maintain that curfew that we have today for the general population.
Okay.
And on the back end, the technology side, there's a way in which we can, through their memberships, factor in that capability for people who have special permission to use the e-scooter.
Okay.
But essentially, go ahead, Rachel, sorry.
Well, like, let's say Lauren and I go get a beer after this, and, let's say we were service workers, and then we could how will we be educating people on, like, you still can't drink and use the scooter, or, like, we don't want anybody using them inebriated, ideally, right?
That's correct. Yep.
And so even if it's a service worker who gets off at 11, heads out, okay.
Hopefully they're ready to go home by that point.
Hopefully. And then last question is just in the neighborhoods, like, we pretty routinely have a couple scooters on my street, and they're often there for extended periods. And I'm looking at the spot in a neighborhood, Park East Square, where you've designated a street. Like, how many neighborhoods will that happen for, or what are we doing in terms of the designated geofenced spots where, it is obstructing when they're on the sidewalk for general neighborhood people getting around? How are we going to do that? Like, not in the areas that are designated, that are easy to geofence, such as Boulder Junction, but like on just random streets.
Right. So a lot has to do with the use, like where are the hot zones where people are picking up the scooters and dropping them off most. And so we'll try to choreograph that data that we have today with how people are using them, with where we would locate these new stations and make them visible for people. So a lot of the neighborhoods that we'll see will have these pop up, if you will, designated areas where people can drop off the scooter. But essentially, we want to forego the ability just to drop off a scooter anywhere. And so the frequency of these is going to be really important with the success of this program, so that there's enough locations that people have an opportunity to drop them off.
Well, but I assume that what's happening in my neighborhood is people are picking them up on the perimeter of CU and then driving the full mile to their house, and there's not going to be an easy place along Thunderbird Drive to park one. So, but if you got a one-off doing it pretty much every day, how are we going to get those out of people's way?
So there is a trade-off, a convenience trade-off to some degree, but it's working pretty well with B-Cycle. That's a dock system, and they're seeing, 6 times as many trips on e-bikes today. So although there is a
But they're not
trade-off-
leaving the e-bikes like along Thunder.
But
They wouldn't.
They're shifting to, right, so it'll be less convenient, but you can't do that anymore.
Okay.
Yes.
You won't be able to do that on the other side either. Okay.
That's correct, yeah.
Okay, all right. Thanks.
Natalie was just clarifying that if you don't bring your e-scooter back to a designated parking zone, then the clock is still running on your wallet, if you will, until you check that sucker back into the.
But then those people also won't be able to use it because if we don't have a spot where they can park it within a block radius, we're losing. I mean, that person rides it every day. That person's going to put the miles back into the greenhouse gas emissions, which we don't want either.
Can I ask a follow-up question? Would we be receptive to feedback? Like if somebody says, I'd love to use one of these, but the nearest one is a half a mile away.
Oh, absolutely.
Would we say, well, let's look at a spot that's a quarter of a mile away or a tenth of a mile away?
Yeah, this is going to be an organic process by which we roll this designated parking area out. And so we're not going to nail it at the first time, but it's going to evolve over time to figure out where those hot zones are where people want to check out an e-scooter. I mean, we get the fact that we want to maximize the convenience, but that over-convenience factor has, unfortunately, a negative impact on people who want to use sidewalks. And so it's blocking sidewalks, and particularly with people with disabilities. And so we're kind of up against these trade-offs. But I think it can be managed in a manner that addresses, like you said, Mayor, those locations where there's demand.
Yeah, I'll just add, it's similar to B-Cycle today. I mean, it took us a number of years to get to fine-tuning those locations and what makes sense for people. And so I think we're going to have to take people's feedback, and it'll be a bit iterative over the coming year.
Good enough. Right, Matt and Laura.
That said, we do plan to maintain the dockless capability at some of the activity centers in the city. So major shopping centers like 29th Street Mall, Basemart, shopping area. Those particular areas will still have a dockless capability, so you can pick it up, drop it off anywhere you like on that property. Sorry, just want to clarify that.
Thanks for the presentation, DK.
Thank you, Matt.
Find it kind of interesting that with miles traveled, it's almost a full round trip to the moon and back. So I think that's pretty cool. My question, since goes around sort of what are I didn't really see in here, so I'm curious, are there estimates of what the 2020, with the expansion, what these 2023 sort of metrics would be in terms of trips and distance traveled and any of those pieces? So I'm just wondering, like, what level of growth would we see to these numbers, right? If it's 400,000 number of trips for e-bikes, are we looking at double, triple? I'm sort of just wondering, what is that estimate for given the expansion?
A lot of the numbers will need to be worked out depending upon where the demand is. But if we doubled the fleet, and because of the greater frequency or the greater accessibility throughout the city, we would see more trips taking place to access origins and destinations. So even though we'd be doubling the number of scooters, number of devices within the community, we could possibly double or even triple the amount of greenhouse gas savings because of increased induced trips.
So that nonlinear growth is good. That's a good segue. And you mentioned greenhouse gases. That was going to be my next question is, do we have a way of estimating? Because I think we saw roughly 50% of folks riding it said they were doing this in place of riding a vehicle. So that tells me there's got to be a way to formalize greenhouse gas reductions in regards to what our climate goals are. And so I'm wondering, has that been done, and is there a way to fold that in, and how tangible is that greenhouse gas reduction with regards to directly folding that into our climate goals?
It's very doable, and we've actually been in contact with climate initiatives on a lot of the stuff. Also in conjunction with the electric mobility work plan, so trying to fold that element into this overall project too, because that relates exactly back to greenhouse gas emissions. So to have the benefits, greenhouse gas benefits that we've seen, and then projecting into the future what we could see is underway.
All right, awesome. Thank you.
Lauren?
Thank you.
Thank you. You talked about having geofencing for parking, and then I know we also have like where we're allowed to ride them currently.
Right.
as we expand, it seems like there might be areas where lower speeds make sense. Can we do geofencing for speed requirements?
Yes, we can. Right now, the speed limit is 15 miles per hour. That's for both e-bikes and e-scooters. But if there's a certain area of town where we want people to go slower, so let's say we want, they're coming up Boulder Creek Path, they're coming through Civic Center Park, and we want them to go 8, we can geofence that large area so that they can slow the scooter down and only go 8 miles per hour in those higher, pedestrian congested areas.
Mm-hmm. Thank you. So will we be kind of collecting data and looking at where that might make sense as we move forward?
Absolutely. This program most definitely is organic and will evolve over time. The optimization, you just don't jump over it next day and you're there. It's going to take time to refine it, so it'll get better and better.
Thank you. My other question is sort of about the affordability. And you talked about, working with community connectors and sort of discussing with people some of the hurdles to that. Might we also look at how the program itself is structured and if there are ways for us to not require people giving personal information to a private company or some of the things that are making people uncomfortable? Like, can we come up with a different mechanism that allow, like you were talking with businesses, how, they could keep track of employment and use that for hours that people are allowed to ride. Could we say, if you're in the affordable housing program, that you automatically get this reduced rate and that doesn't require you to enter a lot of personal information?
Yeah, we'll need to talk about that more with Lime as they are their provider, and they have a terms of use contract that they have with each individual rider, and so having some of that information and having them sign the waiver is key. And then also the requirements for the Lime Access program right now follows federal documentation of being eligible for the affordability program. But there might be ways in that area anyway to have some more flexibility potentially. And if there's a way in which, I don't want to give this away, but if the city can help subsidize that program through Lime to help those folks better access the program, that potentially could be a good use of those funds that we've collected through fees to enter back into the program to support it.
Thank you.
Okay.
Just one question. I'm amazed at the sensitivity of the geofencing concept. Is it possible to, one of the major concerns obviously is pedestrian safety on sidewalks. Can you geofence a sidewalk?
So that's the trick with geofencing right now. It's not that laser-like focused in terms of where you. So geofencing right now cannot distinguish between 10 feet between a sidewalk and a street. We can take large portions of of ground and then geofence that zone, but to say we can geofence the sidewalk, but we're not going to geofence the street we're not capable of doing that at this point. So that's why when we roll into the more sensitive areas like Pearl Street Mall and University Hill, we got to think really carefully about how we allow access to those areas. We want circulation through, but we definitely don't want them riding around in the downtown on sidewalks. And so that's going to be the trick moving forward.
Well, as someone who almost got run down on Walnut by somebody on the sidewalk at about 15 miles an hour, I'm a little sensitive to that issue.
Understandably so.
Okay, thanks.
Mm-hmm. Nicole?
Thank you, and thanks for the presentation. I'm asking you to have a little bit of a crystal ball here, so I understand it's a harder question. But I'm wondering when higher density neighborhoods in larger residential or largely residential areas can think about getting these scooters. And I think I may be being a little bit selfish here, but it seems ideal to have them embedded in neighborhoods like mine that are higher density residential, but still have half a mile to a mile to go until they can get to transit. especially in, some of these neighborhoods that are higher density, that the savings would have a significant impact on people's cost of living. So anyway, with your crystal ball.
Yeah.
do you have a
Well, I
sense
would
of
say that
what it
Lime
would
is.
get there?
Oh, I'm sorry. I would say that Lime is very keyed into where they're going to be able to make the most money. They are profit motivated, and so they're going to want to provide the service to where they're going to see the most use. And high density neighborhoods are going to be those areas where they're going to want to stack the area with scooters. I mean, to be frank with with the financial aspect, but they do have to maintain a profitable business, and that's tough to do. But it's interesting because that is also what kind of drives use, is the high demand. And high density areas have higher demand as opposed to the lower density areas within the city. Does that help, Nicole? I can't see you.
Yeah, and I mean, are you thinking like maybe years, or are we thinking, a decade? I'm just trying to get a sense of what the timeline might be for expanding some of this micromobility stuff into neighborhoods.
Well, in the next year, I think we've got some stuff on the east side that we'd like to get in shape before we expand into west of 28th Street. And so, but I would imagine it's this year that we begin to expand citywide. But I can't give you the exact month at this point.
Thank you.
Thank you.
Great. Are we ready to start giving feedback?
Wait.
Oh, Terry, got a question?
Yeah, I have a bunch of questions.
Ooh, bunch. I missed you. Sorry. Apologies.
So first of all, wait, let me just look at my notes for a second. Okay, my first question is hybrid. So just for me to get this, do you mind if I stand? So I'm not going to sit.
Yeah.
My first question is hybrid. So it's hybrid because you're still going to have certain streets that are dockless, but you're not going. People aren't going to be able to take their scooters home anymore.
Correct.
And leave them there on
The
the street.
hybrid really refers to, like I mentioned, having the dockless capability at some of our activity centers, like shopping centers, but then creating the mandatory designated parking everywhere else.
Yeah, that's a bummer, really, because I think it says 49% of riders use it because it's simple. They just have to throw it somewhere. That's the unfortunate part, but it's also the fortunate part.
It is a catch-22.
Yeah. So I'm wondering, can you, I'm thinking about how I know it's illegal to ride them on sidewalks, but I noticed that almost every Lime scooter person said they didn't feel safe to ride them on the streets, especially like Arapahoe and such. Would there be possibility, and who can blame them? Right. Nobody. Yeah. So would there be possibilities of certain streets like Baseline, up Baseline, down Arapahoe, where they can, nice wide sidewalks that they can ride them?
Absolutely.
Legally?
Yeah, we didn't have that in the presentation, but that was included in the memo.
Yep.
To look at the policy around riding e-scooters on sidewalks and recognizing that not all corridors and sidewalks are equal, and that there are some locations where there's very low pedestrian volume, and those areas may be suitable to allow e-scooters on sidewalks, like 55th Street, like Arapahoe, like you mentioned,
That's
and
right.
Baseline and whatnot.
Right, so I would think more suitable than like University Hill, where there's a lot of smaller streets and, people nervous about being hit, like Mark.
Very true.
For instance. Is it possible to have fines for bad behavior so that all the other people don't have to be,
What's interesting, when you say bad behavior, do you mean like operating the scooter or parking the scooter? Like
parking. Well, in general, it's just it's a pity that most people are probably fine. They probably behave well, and there's a small percentage of people that are this far from hitting Mark, or drunk, or
Right. So we're speaking of the enforcement of where people are riding and how they're riding.
Yeah.
And that is a difficult thing to address. And frankly, PD right now at this point doesn't have the resources to focus on.
I was thinking of Lime giving them a fine. If there's some way that they can look in their crystal ball that Nicole was talking about and say, hey, I can see that person.
Get off the sidewalk.
Or for like throwing them in a ditch, which just seems rude.
You know, a lot of times when the e-scooters are parked improperly, it's because they've been tampered with after the use of the scooter. So it's the third party, and that's why getting back to the designated parking area makes a lot of sense, because you don't have e-scooters that are, you know, far away from the, you know, kind of the main area where they're being used. And so when they are more remote, they're more susceptible for vandalism, and that's when they end up in trees and in ditches and whatnot.
So then it makes sense to change that anyway to docked.
Bring them back to the
closer.
barn,
Yeah.
if you will.
And my last question has to do with there was the last mile and via. So are you saying, because I'm thinking about we always talked about the last mile when we were on the campaign trail. I just learned what it was like a year ago. Good for me. And but let's say somebody gets off a bus. Are they then going to are there going to be scooters right there for people to take? What does via have to do with it?
So yes, the first and final mile is a significant aspect of shared micromobility to pair these devices with transit stops so that people have the combination of being able to use a scooter or a bike to get to a transit stop, take the bus, get off the destination, and then have another one available for the last leg of their journey. So that makes sense from a local perspective too, and we're also thinking about that from a regional perspective. What's on the other side of trips in Longmont? What's on the other side of the trips in Westminster? And when they get here to Boulder, do they have an option of micromobility, shared micromobility to complete their trip? And that's what makes transit a lot more attractive.
So that's my question.
So yes, yeah, that's being done today. And as part of our proposed next step, we hope to amplify that.
All right. Good. That wasn't that many questions, Tara. All right. So feedback. Let's see. Staff has a proposal for next steps. Oh no, Junie. I'm so sorry. Junie had a question too.
You just want to end the night. Me too.
I'm getting
I
tired.
promise.
Is it showing?
Well, my question, you mentioned encouraging the city to pursue aggressive incentives and subsidies. And you also mentioned the micromobility card, and I was wondering, what does that entail?
Right. So there was a lot of interest around this when we presented to the Downtown Boulder Partnership and also to the Downtown Management Commission. Thank you. Around providing more transportation options for people who work downtown. Instead of using a car, they can use micromobility. But they want to make it easy. And so through general improvement district tax dollars, potentially those monies could be used to subsidize passes for employees of downtown. And that could be for University Hill, it could be for Boulder Junction, or for the downtown area. And then the concept of a mobility card was that it'd be like a sort of a one-stop shop, and that's really dreaming at this point, how we would be able to use a card that you could use for transit, that you could use for e-bikes, that you could use for e-scooters, that you could use to rent a locker, but having just that convenience factor of just one unit of currency.
Okay, thank you. So when I read it, I was thinking similar to our bus passes, the Eco Pass.
Yes.
And so does that mean you would be working with RTD as well as part of that project, or is that not something that has been yet conceptualized in that way?
We'd like to have that. You want to speak to that?
Well, yeah, I can just say that it's not a project on the work plan yet. It's definitely something that it's a vision that I think everyone shares, kind of the local governments across the region and RTD, and probably also the micromobility providers would be my guess. But the technology really, hasn't been there and been proven, at least largely across the United States yet. So that's something we definitely know we need at some point in the future, but it's not quite there yet.
Thank you.
Okay. Sorry again. Feedback on the proposed next steps. I got Rachel.
I guess I'm just continuing with my earlier concern. Like, I'm so impressed with the numbers on the first and last mile solution, and like our average is 1 mile, right? Like, it's so awesome that we're getting people from their house to the scooter. But I feel like if I'm visualizing the people who are using them in my neighborhood, if they pick it up at Table Mesa Park and Ride or near CU, and especially like people from out of town getting to Table Mesa, they're going to ride it to this, to the street, maybe wherever they're going, and not be able to park it, and then just have to take it back, right? And it's not going to be able to be, I think, as easy to use without the dockless where you can leave it. So I think we're gonna lose people there, and it seems like it almost has to get to a point where on the end of every block you would have one of those things that you showed us in that neighborhood available, because otherwise, if we're trying to get people from their home, and we are a largely, single family home spread out city in some ways, like not everybody's going to live near one of these spots where you can dock. I just think it doesn't make sense to me as a first last mile solution if we can't get to our house and park it somewhere near where we can walk. I think we'll lose people. And we'll miss you.
Thank you, Rachel.
Thanks for being here, and thanks for getting us started with this program.
All right, Matt, Tara, Jeannie.
I'll start by saying I think this kind of exemplifies what a pilot program is, right? You set some goals, you have some aspirations, you set it in motion, you adapt, and then you say, let's let's fix the bad and expand the good. That's what I see here. So I like where this is headed, and I do share some of these concerns, but I think there's been a case study that in this program there's adaptability to want to adjust in real time and make those changes. So credit to staff, credit to Lime for being adaptable and working with us and our community. So thank you. And I like where this is headed, and I'm excited to see where the expansion goes, and especially when it reaches downtown and other core areas. So thanks for all the great work, and look forward to seeing that expansion and hitting maybe a distance to Jupiter instead of just the moon in a couple of years.
Yes.
Jupiter's a lot farther away than
I know.
This is. I know you know. Okay, Tara. And then Junie, and then Mark.
One of the reasons why I'm the most excited about this is because a fair amount of people don't like the traffic here, especially people are worried about the traffic CU South is going to bring. So, I hope people aren't watching me late at night. Everybody shut off their TV already. So that will be great if students are really on these things, and so that really is exciting for us for less traffic. Because more students are riding e-bikes and they're also riding scooters. So although some people are scared of being hit, I look at the good, and that is that we're going to have less traffic because students really like to ride them. I live near CU, so I really enjoy watching the students ride them, and most of them are very polite on their scooters that I've seen. So I'm just going to stick up for the students here. So I'm excited. That's all I have to say.
Okay, Jeannie.
Thank you. I just want to say that from reading the packet, thank you for how do I put it? How do you analyze or put things together when you talked about safety? Again, I've been on council for 3 years, and I've seen this program being deployed, and the concerns had been people with disabilities, the scooters being littered all over the place. And I feel like this particular memo has been really trying hard to explain to us the part of some of the solutions, and the fact that in the future you'll be working on that as well. So thank you for that. That's greatly appreciated. And also another part, you mentioned education as well, using different media to educate community. Thank you for that aspect of it as well. And the safety. So safety, equity, and education, I saw that all throughout the memo. That's greatly appreciated. And one last thought I wanted to add, not to co-opt your idea, but consider geofencing. I welcome that thought around certain time, if that's even possible. Because again, when it comes to community members, people who are maybe using these scooters at night time when they're drinking in certain areas, you're going 15 miles an hour on a sidewalk, there are safety issues there. If there is time geofencing, I think that's a great idea. If there's area geofencing, I also think that would be a great idea as well. Thank you.
Thank you. Thanks, Jeannie. Mark?
DK, thank you, and good luck. I think I agree with Matt. This is really trending in the right direction. When it was first proposed, I had several reservations. The first was scooters ending up in landfill after a couple of months, and that seems to have been taken care of. The second is the unsightliness of scooters everywhere, and I think you're addressing that. Although, frankly, I'm not sure why you wouldn't put geofenced parking areas in the shopping centers. You just dump your bike and go shopping. But the third, I think, still requires a little bit of work, which is pedestrian safety. What I don't want to see happen is have people who are used to walking feel unsafe and get in their car. That sort of defeats the whole basis of the program. So I think there's still more to be done with that, and I hope we will continue to refine this so that safety of pedestrians is dealt with in a stronger way. But other than that, I think everything that I'm hearing is positive and going in the right direction. And you know, as Matt said, I applaud you for the flexibility to adapt to conditions and continue to make refinements to the program. And you know, you've made great progress. You're almost there, but there's a little more work to be done on you know, sidewalks.
Lauren?
Yeah, I appreciate all the detailed thought that's gone into this proposal. I think for me, the two areas that I want to see continue to evolve are just around sort of thinking about maybe different kinds of zones that might happen throughout the city. I think that for a large, you know, especially more dense areas of the city, the geofenced parking areas make a lot of sense. But as we move out into more suburban areas around town, that there might be different areas of town where that doesn't make as much sense. And so just continuing to think about what's appropriate where in the community there with that, and also with speeds, you know, and just thinking about what parts of town, what speeds make sense. Thank you.
Great. I'll call on myself here, and I'm just going to go back to a few years ago when we were teetering on the edge of mobility disappearing, right? Because B-Cycle was on the verge of going away, and we didn't have a good scooter program or plan in place at that time. And it was really looking pretty bad for our first and final mile micromobility future. And meanwhile, B-Cycle, not the subject tonight, but they've transitioned to e-bikes successfully. Their numbers are through the roof, which is fantastic. And we've had this very successful e-scooter pilot. So just huge kudos, right? Like it was looking dark there for a little while.
It was, yeah.
And it's going so well now. And I think you're absolutely on target with these next steps. So I absolutely support you. I'll just echo a couple of things. I think Rachel's point about that balance of where the dockings are. I mean, I think it's generally worth it because the sidewalk obstructions and users with disabilities, that's a problem, right? So, but it's got to be done carefully so that it's still a usable program. So maybe that's a phased in thing. You know, maybe the docks take over slowly, you know, and it obviously it's going to be iterative, right? We know that, but that's going to need some work for sure. And I also just want to really commend the focus on racial equity and the way that that's been implemented so far. And it seems like if it hasn't been 100% successful, it's made a real difference. And I think there's probably gotten a lot more riders in those areas than there would have if we hadn't paid attention to that. So kudos on that. And that'll be really important to continue that work as we spread into the rest of the city, right? And to evaluate potential other areas that deserve the same level of attention. So I imagine you'll be thinking about that as well. But just mostly, you know, huge kudos and looking forward to the next steps. Yeah. Did you want to say anything? Okay. So I think that's it. Does that give you all what you need?
Yes,
is that good?
Definitely.
That's good enough. Well, DK, you're ending on a high note. Let's give a round of applause for this. Appreciate your years of service to the city. It's been a pleasure working together.
Thank you, sir.
Best luck with next steps. Yeah. And thanks for the partnership.
Thank you as well.
All right. Any final thoughts before we wrap up for the evening? Okay. Good to go. Thanks for another good set of conversations, everybody. I'll gavel us closed at 10:34.